Friends, let's start discussing right away. And this is one of the question in which the management guideline has been recently changed. And according to latest Park edition for management of tetanus, whether it is clean wound or dirty wound, if there is a history that TT is taken in last 5 years, in both of the case, we do the same management, that is just wound care. Similarly, if the injury is between 5 year to 10 year, again, whether it is a clean wound or dirty wound, we manage both of them by 1 dose of tetanus toxoid. So that means for you can see this guideline yourself. They have 4 category A, B, C, D, and A is up to 5 year, B is 5 to 10 year, and this part is for clean wound, this part is for other wound, and A and B are same in both the side. That means whether it's clean or dirty, 5 year, nothing, just clean the wound. 5 to 10 year, same management, TT, 1 TT. Now, options category C is those who have taken last TT more than 10 year back. More than word should be there, more than 10 year. So if it is more than 10 year and it is a clean wound, again we will just give 1 TT, the same thing which we were doing for 5 to 10 year. But if it is a dirty wound, then we include tetanus immunoglobulin. Now, the last option D is when the patient is unable to give history of last TT. Immunity status is unknown. In that case, we give complete course of TT in clean or dirty both. Complete course means 5 dose of TT. And in clean wound, we only give 5 dose complete course, but in dirty wound, along with complete course, we also include human tetanus immunoglobulin. तो आम भाषा में कहा जाए तो 5 साल तक कैसा भी वुंड हो केवल धोना है, 5 से 10 साल कैसा भी वुंड हो एक टीटी घोपना है, 10 साल से ज्यादा है क्लीन वुंड में फिर से सिर्फ एक टीटी घोपना है, डर्टी वुंड में एक टीटी घोपने के साथ एक इम्यूनोग्लोबुलिन जोड़ देना है. एंड इफ हिस्ट्री ऑफ वैक्सीनेशन इज अननोन, पेशेंट भुतला गया है, भूला हो गया है, तो unknown history में in clean wound we give 5 TT complete course of TT, dirty along with 5 TT we include tetanus immunoglobulin. So now let's come back to the question and see what they were asking. They have given a clean cut injury about 10 years ago. What would you do? So 10 years ago clean cut, whether it's 10 or 14, whether it's 10 or more than 10, in clean cut for up to 15 year, means more than 10 year, not up to 15 year, more than 10 year also, 5 to 10 year also, the management is same, single dose of TT. Now let me change this question a bit to confuse you. Suppose I ask, there is a dirty wound, okay, and in the same way I asked that DT or TT taken 10 year back. Now, out of A, B, C, D, what will be your answer? If in place of clean wound, I made it a dirty wound, then what will be your answer? So my dear friend, try to guess. Okay, now there is 2 type of question which can be created here. Dirty wound DT, TT, more than 10 year. Okay, so this is a thing where you have to give focus. If they say more than 10 year, then along with TT or DT, we add 1 dose of tetanus immunoglobulin. But if they say only 10 year, then the management is same for clean or dirty wound, 1 dose of TT. Okay, so a lot of students in the group are replying very fastly. Thank you so much. More than 20 students have replied and many of them has replied C. But C is a wrong answer. because it's just 10-year history and it's a clean wound, and you can see according to the classification, category B, which is 5 to 10, less than 10 and 5. In this category, whether it's other wound or it's clean wound, only one thing is given, toxoid 1 dose. Okay, so that is there. Now about 10-year is not so clear. More than 10-year, in case of dirty, we include tetanus immunoglobulin. If it is clear to all of you, let me know like this. Oh, SM is saying, sir, please keep discussion as detailed as possible like previous day. Of course, like my first session of NEET, I will try to give you not just the answer of the question, but complete grip over the topic. That is my sincere effort. So please keep asking your doubt if you have any. Okay. I hope this classification is clear and you can take this picture to be for revision again and again. This is the newer classification according to which you have to answer. Now, let's come to the topic of biomedical waste. Is such an important topic. Micro PSM both ask, and one question come every time from this topic. Almost one question every time. So let's have a detailed discussion of this topic here. Of course, you all know SARP waste is disposed in white container. There is no doubt about it. But there is some controversy in this part which we will come. Surgical gloves. All kind of gloves are plastic. So gloves goes in red. Now, what are the point of confusion? First and foremost point of confusion is the vaccine vial. And this is what they ask. Where will you discard vaccine vial? Broken or intact? So you can see it under blue. They have written broken or discarded and contaminated glass including medicine vial and ampoules, except those contaminated with cytotoxic waste. Now let me ask you clearly, do you think vaccine is cytotoxic? Not at all. Cytotoxic are anti-cancer drugs or some radiological things. So vaccine vial are like medicine vial. These are medicine vial. Whether it's broken or not, it will again and again goes only in blue category. Don't doubt it, please. Now, you can see waste SARP goes in white. So that is white directly. And when it comes to gloves, you can see gloves is written in red. Now, some people, student asked this question that, sir, the nasogastric tube or the catheter has some mucosa or something over it. So should we throw it in yellow? No, not at all. All the plastic like catheter, intravenous tube, bottle, tubing, they all goes in red. So gloves also goes in red. Acrylic gloves also goes in red. Now let's come to one more controversial thing. That is, where do you throw the culture plate? Culture plate, because it is made up of glass, so it can go in blue also. But again, Park has helped us there. The Park has written that blood bag, laboratory culture, stocks of specimen, microorganism, live or attenuated vaccine. Vaccine goes here, not the vial. Of course, vaccine is the liquid waste and liquid waste goes in yellow. Human and animal cell culture used in industrial lab, dishes and device used for culture. So culture dish, culture plate is a device used for culture, and you can see it is written under yellow category. Yellow category have this broadly 6 thing. Human anatomical waste, of course animal is like that. Soiled waste, like you will see cotton or swab, they have asked it already. That will also goes in yellow. Then expired or discarded medicine will go in yellow. Chemical waste will go in yellow. Liquid waste will go here. Then of course soiled waste include discarded linen, they will also go there. And finally culture plate, culture medium, both will go in yellow. Now two more confusing question I would like to ask from you. Where will you throw the plastic wrapper of syringe? And if there is a plastic wrapper of syringe, where will you throw it? Can you answer it? Plastic wrapper of syringe. See, if you answer the category, please reply. If it is wrapper, wrapper has not yet come with any blood or any patient body fluid. So it is just sterile like garbage. And all the garbage goes in black, so that will also goes in black. And we have discussed it earlier also that PPE kit is made up of plastic, so it will goes in red. If you have any doubt for anything where it is thrown, feel free to ask it in the group right now. I would be more than happy to answer it directly from the park table. Plus, you can use this table and picture for your future reference also. Now, Jimmy Jaipur Jackson has a question. Solid syringe without needle in red. Yes, dear, it will goes in red, but that is one area where park is also confused. That is not solid syringe with the solid. See, you can see syringes in red. They have written this part. If you will focus, I am lighting it with black. Syringes without needle goes in red. Without needle goes in red. Where the park is confused, park has written fixed needle syringe in red, and if you see, it has also written fixed needle syringe in white here. Syringe with fixed needle. So this is one area, fixed needle syringe or syringe with fixed needle, where park is confused and written it in red and white both. But still, I would like to mark white if they ask needle without syringe. Needle only, of course white. Syringe only, of course red, because syringe is made up of plastic. But if they ask syringe with fixed needle, this is a confusing one according to park also, but still the better answer will be white, because in white we first usually burn the needle and then we throw the things. White are usually for sharp waste, so it's better to answer white, but park is also confused there, so it's okay to be confused here. Now there are some question like Euro bag or urine will go in red, okay, then PPE kit in red for sure. Sayyid Anwar is asking cytotoxic syringe. Cytotoxic word directly yellow, no doubt. Syringe, needle, vial, anything cytotoxic, yellow. But vaccine vial in blue. Okay. Chalo. So that is there. Jamie Jaipur second is giving PSM WSM as mnemonic, white for sharp material. Is white for sharp material, but there is one catch there also. If you have to throw scissor or K wire off or something like that, so scissors you can use in the next operations also. You need not to throw every scissor after every operation, and you know we sterile it with autoclave and reuse it. So those metallic instrument which are sharp and which can be reused, they go in blue. So when it comes to white, it's better to remember four things which are under sharp in white. First is scalpel, second is needle, third is syringe with fixed needle, fourth are blade. And these four things are written here in white clearly: scalpel, blade, needle, syringe with fixed needle, and contaminated sharp object that may cause puncture and cut, it will go here. Okay, but metallic body implants like pacemaker and all, they will go in blue. Okay, so these are the things. I hope it is all clear to you. Let me know if there is anything other than that. Use that table to clear your future doubt also. Now in the Factory Act, what is the maximum hour of work per week? I hope you all know. Answer is, but it is confusing. People answer 60. No, it is 48. We have discussed it in our first session also. Unless they use the word overtime. Overtime is included. Overtime plus maximum hour. Then it will become 60 hour. And if they ask for one day, answer will be 9 hour, including 1 hour of break. If they ask for 15 to 19-year children, answer will be 4.5 hour plus half hour of break is the maximum hour of work per day. Now, which are the following was launched to ensure complete immunization of children? Complete immunization, of course, Mission Indradhanush will be the correct answer, but a better answer will be intensified Mission Indradhanush, because as I said, Mission Indradhanush was launched only for 7 vaccine, not for all vaccine. Now we have intensified Mission Indradhanush 5.0. It is for all vaccine of National Immunization Schedule. Okay, for all vaccine of National Immunization Schedule. And in Mission Indradhanush, what are the 7 vaccine? We have read it already. DPTR 3. Then there are 3 which are given at birth: OPV, BCG, and Hep B. And the last one is MR. Now, do remember one interesting point here, that vaccination is not a work of ASA or Anganwadi. ASA and Anganwadi worker, they don't do 3 work. They don't give vaccine, they don't make malaria slide, they don't conduct delivery. 3 work not done by them. So who make malaria slide? Of course, I hope you all know, malaria slide is being made by MPW, multi-purpose worker, which is same as health worker male, by active surveillance, where they visit every house of the village once in 14 days, and then if any fever case came, they will make 2 blood smear from them. So these 3 is not the work of them, but still ASA is paid for all the vaccination, paid for all vaccine. So she is paid for all vaccine except this, not paid for these 3. So you might think that if ASA is not giving vaccine, why she is getting paid for it? Because ASA acts as a motivator. She motivates the mother to go for vaccination and take it. Now, if she is motivator, why she is not getting paid for BCG, OPV, Hep B? Because these 3 are given at birth. And at birth, mother and mother-in-law are in the hospital. So whom the ASA will motivate? Father-in-law, है ना, ससुर जी, किसको motivate करेगी? There is no one to motivate. So ASA don't get paid for these 3. Again, a PYQ, you should remember. And very frequently they ask which is not a work, which is a work. So if you know what are not the work, you can easily answer what are the work. So let's come to prospective screening. Remember this point, prospective means future we are screening a group of people in future. So this is the like of cohort screening or cohort study. Prospective study and cohort study are synonym. And answer is screening of immigrant to a country. What happened is, let's say you went to Netherlands, then they will keep testing your sputum, or they will keep taking your X-ray for next 3 to 5 years to check whether you have latent TB hidden in you or not. So they are doing it in future for 3-5 years. That's why it is screening for immigrant of the country. Monetary benefit is measured by which of the following analysis? That is cost benefit. Cost benefit simply means how much money you invested and how much money you got. Money earned or money output. That is cost benefit. Now, what is cost effective analysis? Cost effective means money invested. This is also known as cost effectiveness analysis. Money invested compared with life saved, number of life saved, okay, or quality of life improved. Because we are doctor and we don't just produce money, we also save life. So that's why when you are comparing money with effectiveness, with your role, with how many lives saved, that is cost effectiveness. And if you are comparing cost effectiveness of 2 or more person or 2 or more program, comparing cost effectiveness of 2 or more person program, that is system analysis. Effectiveness of 2 or more person or program. Let's say, suppose you are confused after doing MBBS, you thought let's earn money, and you are confused whether to open a nursing home or to open a medicine with lab and pharmacy. So you will compare the money in them and you will compare the life you will save from them. So you are comparing 2 systems. That's why it is known as system analysis. This is system analysis, comparing cost effectiveness of 2 or more person or 2 or more program. Now, there is 2 questions which I want to discuss from here. One is the question of, which are tough question, ABCVED analysis, on which a question came in recent FMG exam. what they gave the question was that it can be repeated in NEET also, because many a time NEET repeat FMG question, FMG repeat NEET question, so we have to be thorough with them. Out of 50,000 fund, 35,000 goes for drug, for category X drug, 15,000 for category Y, and 5,000 for category Z. So which analysis is done here? Which analysis is done? And in the option they have ABC analysis separately and VED analysis separately. So which is done, they asked. Now, to answer such question, remember A means those drugs which are always needed. And there are 10% drug which are always needed. So for these always needed drug, we should give 70% fund. It includes paracetamol, cough, cold syrup, all those always needed thing. So if you will give 70% fund, those drugs will never be in scarcity, and these drugs are always needed, so they will not expire also. That's why we give 70%. B means better if present. Okay, and there are around 20% drug which are better if present. For them, we give 20% fund. And there are 70% drug which are kept as control, which are rarely used. Like most of the life-saving drug are rarely used. So they're kept as control. So for them, we give only 10% fund because they can expire. And in this question, you can see it. But let's go to VED analysis also. What is VED? V stand for vital. E stand for essential. Vital means life-saving. E for essential. And D for desirable. It's okay if they are there, if it's okay if they are not there. So, in this question, they are distributing fund, money. And you can see money is distributed in the ratio of 70%, because 35,000 is 70% of 50,000. Then 20%, 35, 15, no, 35, 10 and 5 was the three option, 10 and 5. So 70%, 20% and 10%. So this is clearly a case of ABC analysis. Now they can ask a second question from here. Which category of drugs should be given highest priority? So do remember that we give first priority to category AV, which are always needed and vital. Life-saving and always needed. They are first priority. AV category, first priority is AV. Second priority is vital and better. Like that we decide. But most they ask first priority AV. One more similar question on this topic came in INICT exam. That was based on monthly drug order which we put. So monthly drug order which we put has two things. One is average consumption in a month. Average monthly consumption. And second is based on, and they multiply it by reorder factor. So reorder factor is written as RF, and reorder factor is 2 into N. What is N? N is number of month. So if you are ordering for 2 months, reorder factor will be 2 into 2, 4 for 2 months. If you are ordering for 1 month, reorder factor will be only 2 because it will be 2 into 1. Now, the question which they asked was that there was the data is difficult to remember, but still let me try for it. Some 10 patient on telmisartan, okay, from some other PHC came, and there were 40 patient on amlodipine, 10 mg. And amlodipine is given HS, of course, before sleep. It can lead to pedal edema also, you know, in some cases. So what they're asking was, this was the patient they are there. What is the amount which you will order for a month? Amount order for a month they ask. Now, if they ask for a month, first you have to find what is the average monthly consumption. And they gave this two order. If you can answer, try to answer 3000 and reorder factor equal to 2. 1500 and reorder factor equal to 2. What is the answer? Then there was 1600 and reorder factor equal to 2. And these were the options. So how to solve this question? 10 patients are taking it OD for, of course, 30 days in a month. So we will multiply 10. They are taking tablet once a day. So 1 into 30. So 10 into 30 will be 300 tablet. And again, there are 40 patient amlodipine HS means once a day. So you have to multiply 40 with 1 with 30. So 40 with 30, if you will multiply, it will come 1200. So total medicine which we are ordering is 1200 plus 300, 1500 we are ordering. Now what is the answer out of A? You are not able to see B option. Option B is 1500 and reorder factor equal to 2. So out of A, B, C, what is the correct answer? Try to answer it. People think it is option B because it is 1500. But they are not asking monthly consumption. They are asking what amount you order. What is the amount which you will order, they are asking. And in case of ordering the drug, we have to multiply it with reorder factor. So 15,000 to zarurat hai, 1500 is the need. Sorry. I choose the wrong one. Yes. 1500 is the need. Okay. And we have to multiply it with reorder factor. For 1 month, reorder factor will be 2. So 1500 into 2, answer will be 3000 and reorder factor equal to 2. Option A will be the answer, 3000 reorder factor 2. Okay, it will not be 1500. So this was the exact question with exact data. If it is repeated, you can easily answer it. Okay, now let's move. Jimmy Jaipur Jackson is asking some question on silicosis X-ray. Silicosis X-ray have this appearance of snowstorm appearance. Snowstorm appearance means there will be fog-like thing, fumes-like thing on the X-ray. That is snowstorm appearance on silicosis, which occur in cement factory worker, tiles factory worker and glass factory worker. And if it is asbestosis, asbestosis will have mesothelioma, cancer of lung, pleura. So because it is cancer of lung pleura mostly, there will be this opacities will be there on the basal areas. That's all I know about them. If you want to know the details of X-ray on these two things, it's better to discuss it with some radiology faculty. But this two part, if they gave directly, mesothelioma, asbestosis and silicosis is there. Mostly when they ask disease from occupational part, they are asking the question from causative organism. Like what is the causative organism of bagasosis, they ask. What is the causative organism of farmer lung, they ask. Farmer lung, okay. So in bagasosis, the causative organism is thermoactinomycetes saccharide. And do remember, a lot of us think that bagasosis occur in only sugarcane factory worker, but no, it also occur in cardboard factory worker along with sugarcane mill worker. The causative organism of farmer lung is Micropolyspora fani. Polyspora fani. Okay, so do remember the causative organism also. Now come to this question, next question. Okay, okay. So system analysis, cost benefit, cost effectiveness. I hope it is clear to all of you. But let me give you a very interesting question from this topic. Suppose you have to select one doctor among two doctors who come for interview. How will you select? There are three methods of selecting on which three questions has been asked in the past. First method is you will select them based on their extracurricular work. Suppose what is the extracurricular work a doctor can do? He will not perform, he can do marketing of the hospital, he can do counseling of the patient, grief relief and all. These are the extracurricular work. So it means suppose there are two surgeons, Both are taking 3 lakh of surgery per month, but one is also doing marketing. So the one who is also doing marketing is more cost effective. So you are comparing cost effectiveness of two doctor, and comparing cost effectiveness of two person or two program is known as system analysis. So if you are comparing doctor based on extracurricular work, system analysis. Second way of choosing doctor is based on consensus of group of people opinion. Okay, like you can ask it from the hospital where they have worked in the past, that how was the behavior of Sahid Ahmad and Vaibhav Jain, and suppose these are the two surgeons. So this method is known as Delphi method. And Delphi method, they have asked this question in a different way. Delphi method is a group method. Delphi means you are taking consensus of people who are working on some topic, on some idea. So this is Delphi method. You are not able to see the down part, so it is Delphi method. And Delphi method is a group method. Now third way of selecting is based on time taken to do surgery. Let's say Vaibhav Jain is doing the surgery in half an hour, and Sahid is doing the surgery, Sahid Ahmad is doing the surgery in 1 hour. So this is known as work sampling. Work sampling simply says choose that doctor who is doing it in half an hour or short time. Directly choose Vaibhav Jain because he is taking less time. So that is work sampling. Based on time you are selecting doctor. But that might not be correct now. Maybe Vaibhav Jain is connecting wrong wires in hernia surgery. He is connecting wrong wire together. So that after surgery, whenever the patient cough, there is an erection. So it's not good to decide based on any one of these individually. It's better to use all of the three methods to choose among two doctors. But these three questions has been come already in the past exam. So do remember it. Now let's come to our questions. A 24-month-old child weighing 11 kg was brought to pediatric OPD. He had a respiratory rate of 38 per minute. So one thing is sure, it is 24 month, and if the child is, I think we remember the last discussion, more than 60 for less than 2 months is fast breathing, and if it is 2 months to 1 year, it is more than 50 is fast breathing, and if it is more than 1 year and more than 40 only, then fast breathing. So it is 38, that means there is no fast breathing, but there is chest indrawing. And if any one of these present or both of them present, we just classified it as pneumonia. It is not severe pneumonia unless there is stridor or danger sign. So if there is stridor or danger sign, then it is severe pneumonia, where the drug of choice is gentamicin injection, and then we refer the child urgently under which color tag? Under pink color tag. So severe goes under pink. But this is pneumonia, it goes under yellow. And in pneumonia, the treatment of choice is oral amoxicillin for 5 days. If it is just cough and cold will have neither fast breathing nor chest indrawing, then we will classify it under green, and we will give some cetirizine or some syrup if needed for relief, symptomatic relief, and ask for home treatment. So this classification we have done in detail, diarrhea, pneumonia classification in part 1 of the discussion of NEET PYQ. This is part 2. So if you have not gone through it, please look at the part 1 also one time. Okay, now let's move ahead. I hope you all agree here. Next question is, an employee diagnosed with TB get extended sickness benefit for how long? Of course, if they ask extended sickness, this is for 2 years. But if they ask enhanced sickness benefit is for cutting the wire. Vasectomy and tubectomy we give enhanced sickness benefit. And of course, which one is lesser surgery? Vasectomy is small surgery. Now already the balls are hanging below, so you can cut them easily. So it is 7 days for vasectomy. Tubectomy is big surgery, so 14 day. And how much salary is given here? 100% salary is given because you are cutting your wire for the country. You know? So that is there. And of course for your family also. Now, one more thing they have asked is, of course, sickness benefit, just sickness benefit. So extended sickness benefit is of course 2 year and there is 80% salary which they get. When it comes to sickness benefit, it is 91 day and there is 70% salary that they get. The question which they ask from here is, in India, the maternity benefit which is given, is it for 24 week, 26 week, 28 week, 30 week? Can you answer it? 24, 26, 28, 30 week. Of course, there will be 100% salary. But I think they say 6 months and 6 months is very less because 6 months is the duration of breastfeeding. If government is giving 6 months only, it means either they expect that all the children of working mothers should be deprived from breastfeeding. Exclusive breastfeeding will not be possible. Or they expect that women should deliver on the duty. None of them is morally correct. So it's very less. I think it should be 9 months. But what is the answer? 24, 26, 28, 30. What do you think? Very good, Jimmy Jaipur Jackson and Jayesh and Sheikh Adil. You all are right. It is 26, not 24 or 28. Similarly, one question they ask from here is, when we are doing fasting blood sugar in pregnancy, what is the best time to do it? Best time is 28 week, but average is 24 to 28 week. But best, if they ask, 28 will be the best time of doing, not fasting, random blood sugar. Because at sub-center level, village people do not maintain fasting so easily. So usually what we do is random. And in pregnancy, we don't ask mother for fasting also usually. So we do random at, ideally at 28, but 24 to 28 is the best time. Do remember. And this question separately came also that at sub-center we do fasting or random. Answer is we do random blood sampling there. Chemical waste is disposed it. We already know liquid waste, chemical waste, anatomical waste, soiled waste, cytotoxic waste, discarded medicine, all goes in yellow where we do incineration. But if you are working at PHC or peripheral area, then incineration facility will not be there and then we can do deep burial. Deep burial means we will dig a pit cemented from all the 5 sides, we will throw some waste over it, then allow the soil to deposit over it. But if you are throwing placenta on it, do not forget to pour some bleaching powder over it. Otherwise, dogs will come smelling it and they will create a scene over there. Now, let's move ahead. Which of the following technique is based on behavioral science? So, behavioral science technique can be remembered by the mnemonic PCIMO. Suppose Priyanka Chopra came to your flat. So, what are the good things in Priyanka Chopra? One is the personality, the personal skills and development. One is the C. C means communication skill, personal skills or personality development. One is the communication part. And when she will come, she will give you the information. Ki dekho, main aa gayi. So information is there. And she is coming to your room. So she will manage you according to her objective. Na? So that is management by objective. She will manage you according to her objective. And before leaving, she will change your organizational design. You will be shaken if she come. So it is organizational design, which is the last thing. So I use this weird mnemonic so that this strange topic should stick in your mind. Now let me give you a practical hint. What is this behavioral management technique thing? Let's say you opened a hospital and the first thing you should do in your hospital is you should make an objective. Let's say your objective is every patient should go with a smile, because if they go with a smile, they will come back with more relatives and patient and you will earn more money. So patients should leave with a smile. This is objective. For this objective, you will develop the personality of the staff, that they should bow down to greet, they should be more humble. You develop the communication skill, teach the employee about the local language also, so that people will be more happy listening to the local thing. You will have an information system so that if any employee is on leave, you will know it and the things will be arranged without bothering you also. And so that hospital can run in a smooth way, and it should not be dependent on one person like you. And so there should be a good information system. Then organizational designs should change. That means, of course, every small complaint of patient should be taken care of. So there should be some complaint box. There should be some appreciation box also, always, for good work of the hospital staff. And for pediatric patients, the room should have more play areas and all those things. So these 5 ways you can make your hospital run very well. These are the management techniques of behavioral science. So correct answer will be management by objective. Remember PCIMO. Okay. Chalo. Now, a study was done to assess nutritional status among young children in rural and urban area, and 30 children in rural and 20 urban area are malnourished. We have discussed this thing already, that if they talk about any disease, let's say hypertension, anemia, obesity, malnutrition, disease, we can only categorize as mild, moderate, severe hypertension, mild, moderate, severely malnourished. So all the disease are just category. Disease are categorical data. They can only be categorized. And if they are only category, that means they are quantitative. Sorry. Very sorry. I was in the flow of Priyanka Chopra. If there is category means you cannot measure it, you can just categorize it. So these are qualitative. Second thing which I told yesterday is, in qualitative question there will be percentage and proportion. So in any question, if you found the word disease, hypertension, diabetes, anything, and the data have percentage proportion or the data have median and mode, in all these questions it is qualitative data, and for qualitative we use chi-square test. So answer will be chi-square test. Okay, you can easily answer all these questions which are based on categorical data. Next question is, as per NCEP ATP3, which is not a criteria for metabolic syndrome. Metabolic syndrome have triglyceridemia more than 150 is one criteria. There are 5 criteria for metabolic syndrome. One is hypertriglyceridemia. Second is central obesity. Central obesity means more than 102 centimeter waist circumference or more than 88 centimeter of waist circumference. 102 centimeter. Tell me, who have bigger waist circumference, male or female? Tell me, 102 will be for male or 102 will be for female? And of course there will be hypertension, but for hypertension they have took the BP more than 135 and more than 85. 130 and 85 is the cutoff which they have taken here. So this is one criteria, hypertriglyceridemia. There is second, central obesity. Third, hypertension. Fourth is fasting blood sugar. Of course, if it is raised, that is fourth criteria. And fifth is, if HDL is less than 40 in male and less than 50 in this less than 40, less than 50 HDL for male and female. These are the fifth criteria. So 102 who is for waist circumference of male, क्योंकि मेल का होता है कमरा, फीमेल का होता है कमर. और किसी ने भी फीमेल आंसर नहीं दिया. आई थिंक वेरी गुड. If you have answered 102 for female, it means you have forgotten all the song written on thin waist of female. In every language there is song written on thin waist of female. But have you seen in any movie कि वाह क्या जवा मर्द है, क्या पतली कमर है? नहीं ना. So thin waist is for female 88 and 102 is for male. Second thing you should know is about waist to hip ratio. Waist to hip ratio is bigger again in male, because waist is bigger in male. If it is more than 1 in male, it is obesity. If it is more than 0.85 in female, it is obesity. Okay. So do remember waist to hip thing, and answer is high LDL is not a criteria for of course metabolic syndrome. Now when we are revising this thickness thing, whenever come the waist thing, always remember me. Teacher with bigger waist circumference, Kamara. So you will not forget, always male will have higher waist circumference. But the last criteria is skin fold thickness. Tell me, who have bigger skin fold thickness? Male or female? किसकी चमड़ी मोटी है, male या female? What is your answer? And it is measured by which instrument? Measured by Herpenden caliper. Okay, there are 4 sites to measure. That's what they ask. Triceps is the best site to measure. Then there is biceps. There is subscapular area. And there is anterior superior iliac spine. We take the average of these 4. If it is more than 40 mm or more than 50 mm, we classify obesity. So tell me, who have bigger skin fold thickness? Robin Singh is correctly said that it is bigger in female because they have subcutaneous layer of fat below their skin. Okay, that is why female skin is so soft to touch. होती है कि नहीं female skin soft to touch? हाँ, होती है ना? एक क्लास में मैंने ऐसे ही बोला, होती है कि नहीं फीमेल स्किन सॉफ्ट टू टच. सेकंड रो पे एक बंदा बैठा था, वो बगल वाली बंदी का स्किन छूने लगा और बोला हाँ सर होती है. मैंने बोला नो 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 नो, ऐसे नहीं पता लगेगा, छूना नहीं है, तुम्हें चूटी काटना है ना. यू हैव टू पिंच टू नो द स्किन फोल्ड थिकनेस because it is measured by Herpenden caliper for pinching, and you can see in the word itself there is her, so it is bigger in female, है ना. And this time when it comes to skin fold thickness, don't remember me. Otherwise, you will think male with hippopotamus skin and you will answer male. But no, this time it is female. Okay. So, if it is more than 40 in male, it is obesity. More than 50 in female, it is obesity. So, this is, you can see male has lesser, female has bigger skin fold thickness. And they keep on asking these questions of measurement of obesity. I hope you will remember it. Now, in a population study, the value of mean is 200. I challenge all of you to calculate it yourself and answer. And standard deviation is 20. What is the answer? Of course, this is the most common numerical being asked in PSM. You cannot dare to go to exam without revising this formula. 68, of course, it is mean plus minus 1 standard deviation. 95 means mean plus minus 2 standard deviation. What is the answer to this question? Robin Singh is saying कि सर चाटा मार देगी, है ना. If he will touch the girl sitting next to him, he is saying, dear, touch the girl with consent, na. Of course, then she might like it also. Okay, so mean plus minus 1 and plus minus 2. What will be the answer here? Here the mean is 200, plus minus 1 they have said, that means plus minus 20 you just have to do because standard deviation is 20. And plus minus 20 if you will do from 20, it will become 180 to 220. If they ask 95%, then it is 200 plus minus 2 into 20. So 2 into 20 means 160 to 240. So this answer B will be correct for 95% and 68 will be A. Very good. If it is 99, it is mean plus minus 3 standard deviation. Okay. Now, sometime this, in the question they use the word of standard error. And now if they have asked it from for a population, sometimes they confuse it with a standard error, but standard error question calculation need calculator and all those things. So usually 99% time they ask it from this formula. And do remember to revise this formula and do questions on this formula. Which of the following is disposed in the yellow bag? Of course, we have done it already. Blood bag goes in yellow, urine bag goes in red. बड़ा simple है याद करना. लाल में पीला, पीले में लाल. Red color blood goes in yellow and yellow color urine goes in red. लाल में पीला, पीले में लाल, yellow in red, red in yellow. Like that you can remember. Where will you throw gloves? Of course red. Where will you throw sharp? Of course white. So we already know. Calculating one variable using another variable is done by So this is based on these 4 correlations coefficients. And we should know each one of them because 2-3 question in NEET has been asked on this topic. See, first is coefficient of correlation, which is denoted by R, and the role of coefficient of correlation is to know strength of association. This tell us strength of association. Strength of association means how strongly 2 things are associated. For example, if value of R is between 0.1 to 0.3, they call it as weak association. If it is between 0.4 to 0.7, they call it as moderate association. If it is 0.8 to 1, they call it strong association. But if value of R is 1.2, what does it mean? Very strong association? That will mean wrong data. Because R is something which can only between -1 to +1. It cannot be greater than that. So R tell us how strongly 2 things are related. Second thing is coefficient of determination, which is R square. R square tells us percentage variation in one variable on changing other variable. Percentage variation in one on changing other. Okay, so whenever they talk percentage, that is determination. Then there is one thing, coefficient of variance. Coefficient of variance tell about 2 things. It tell about quality of data set and compare dispersion of data. Dispersion of data, how the data is spread. But if one is given and you have to find another, then you have to use option B, coefficient of regression. I'm sure this 4 thing can be confusing. So, do you want me to explain these topics through some example? Because these are confusing coefficients. Or should I move ahead? And of course, I should explain this part. This is confusing part. Let me explain with some good example. See, first thing is, let's say you went to your flat after taking classes and you found that your room partner is ready with a joint in his hand. Light is dim and he is full set. And you are seeing that the marks of your room partner is decreasing because of the number of joint per day which he smoked. Previously, he or she used to smoke 1 joint per day. Now he or she is smoking 7 joint per day. So due to 7 joint, marks has gone drastically down. I hope you agree with me. And now 7 joint is too much. So this type of correlation is negative correlation because it is going down. And the value of R will be around, let's say, -0.7 or 8 here, because it is towards the negative direction. And if I have this plot, let's say, with dots more far apart, then the value of R will be lesser, let's say 0.3, -0.3 only. This is plot B, this is plot A. So sometimes they give image based question from here and they ask which one has a stronger correlation coefficient. So A have dots closer to each other, closer to an imaginary central line. If the dots is closer to each other, it means a stronger correlation. Now, you will say that, sir, have you forgotten math or what? How come -0.8 is bigger than -0.3? My dear friend, here the minus sign is just telling us the direction. Minus means negative correlation, plus means positive. So that is not that real minus plus thing. It is just direction. And if the dots are closer, like in A will have stronger correlation. So you will try to explain it to your room partner that, see, my dear friend, your marks is decreasing because of it. Your room partner will not give attention to your word. Then you can move it further and you can say that, my dear friend, if you do the square of R, it will become minus 0.8 square or 0.64 or 64%. And this is known as coefficient of determination. So what is coefficient of determination telling us? It is telling us that, my dear friend, if you decrease your joint, then your marks can increase by 64%. And so it is telling percentage variation in marks on changing joint, percentage variation in one variable on changing another. So this is coefficient of determination. If you explain it like this, your friend will put one fog of fume on your face and will say to you कि देख भाई अभी तू अपने level पे नहीं है, you are not at my level to talk, let's take one drag, come to my level, then we will talk. And he will not listen to you like that. So then you can use the final weapon, which is coefficient of regression. Regression has the power to tell exact variation. Why? Because regression has a formula y is equal to bx plus c, where this b is coefficient of regression. What is this b? This is the angle which is made. See, in this question, marks is your y, number of joint is on x-axis, this is the constant c, and this slope which is made is b. And here the slope is minus 45 degree. If you subtract 45 from 180, it will become 135 degree. And tan 135 degree is minus 1. So if the slope is in this direction, angle value of b is minus 1. And if the slope is in positive direction, we all know tan 45 degree is 1. So here b is minus 1. I told you your friend is smoking 7 joint per day. And suppose the constant value is 9. We can put any constant value 9. So what is the marks which your friend is getting? Your marks your friend is getting is minus 1 into 7 plus 9. That means he is getting 2 marks or 20% marks right now. So you will explain it to your friend that, my dear friend, if you decreased your joint from 7 to, let's say, 1 per day, now the x is 1. So what will be the value of y? Angle b is same minus 1. Minus 1 into 1. And constant is also same 9. So minus 1 into 1 plus 9, the marks will come 8. So you can tell it to your friend that, see my friend, if you decrease your joint from 7 to 1 per day, your marks can increase from 2 to 8 or 20% to 80%. 2 to 8. So that's why I said regression can tell the exact variation, because it has a mathematical formula. Okay, so this is the whole story. I hope you remember from here that this was the question. If one variable is given, suppose joint, number of joint x is given, you can find the marks, you can find the y with the help of this mathematical thing, coefficient of regression. Okay, so regression is exact variation telling thing, or one is given, another can be found from there. Correlation tell strength, determination tell percentage variation. Now the last thing you have to know is coefficient of variation, which is telling quality or dispersion of data. Let me explain with an example. Suppose you are sitting in my OPD and 2 patients came to you, and you ask from both the patient, when does it wake up in the morning? You are not asking when does you wake up. You are asking when does it wake up in the morning. It means you are taking the history of penile erection. You are in my OPD means sex and marriage counseling OPD. I am a trained sexologist, my friend. I took 3-month training in AIMS New Delhi for this marriage counseling also. They used to send us to OPDs. And there I realized that most of the sex issue is only because we are not talking about it. And if as doctor we will hesitate, then who will talk about it? And so we should talk more about sex, only then we can solve the issues related to it. So now there are 2 patients, you are asking morning erection history. Why? Very important, because if morning erection is absent, there is something pathological. Morning erection present, it is only psychological. So patient 1 said, sir, it wake up between 5, 6 or 7 a.m. Second patient said, sir, it wake up at sometime at 12 p.m., sometime at 5 p.m., 5 a.m. and sometime at 10 a.m. Okay, so, or let's say better answer will be let me change it, the data, otherwise it can get confusion in the calculation part. So the second patient reply, it wake up at 1 p.m., 5 p.m. or 9 a.m. 1 a.m., 5 a.m. or 9. So this is the two data set you have get. Now you have to find the coefficient of variance. Coefficient of variance have this formula, standard deviation by mean. They can ask the small numerical from this part also. What is the formula? Standard deviation by mean. Now, what is standard deviation? It's a very simple thing. First, let's find the mean. है ना? Mean is average. So out of 5, 6, 7, 6 is the mean. Why? Because every number is equally away. If every number is equally away, like 1, 1 away every number, so then middle number become mean. So here mean is 6. Without calculating, we can say, if you want to calculate, you can. 7 plus 5, it will be 12. 12 plus 6, 18. 18 by 3, it will come 6. Similarly, 1, 5, 9 are equally away. So 5 will become the mean. Now what is standard deviation? As I said, it is very simple thing. It is the average distance of each number from the middle number. How far is 5 from 6? 1. How far is 7 from 6? 1. So standard deviation is 1. Did you understand what is standard deviation? Suppose you are sitting in the middle of the class. So average distance of all the students from you will be standard deviation. Okay. So here standard deviation is 1, mean is 6. So the value of coefficient of variance will be 1 by 6. In patient 2, standard deviation is 4. You can see 5 is away from 9 by 4. Mean is 5. 4 by 5. So this second data set, the coefficient of variance is bigger. First data set, coefficient of variance is small. And a smaller coefficient of variance means better quality data. Okay. Do remember these things. If the coefficient of variance is small, or similarly thing also apply for confidence interval. Confidence interval range small means more significant data. This is a question from NECT already. This can repeat again, very important. Confidence interval range is small, more significant data. So remember this line for the rest of your life. We want big things in life, but two things should be small. The smaller the better. What are the two things? Confidence interval and coefficient of variance. हमें बड़ी चीजें पसंद हैं जिंदगी में, लेकिन C से होने वाली दो चीजें कौन कौन? C वाली चीज, coefficient of variance, confidence interval, छोटी होनी चाहिए. Smaller the better. So do remember this thing. Thing with C should be smaller, and smaller the better. So that means patient 1 data is of better quality. And anyway, patient 2 झूठ बोल रहा है. ये रात में 1 बजे, 5 बजे, 9 बजे ऐसे थोड़ी खड़ा हो जाता है यार, ये तो फेंक रहा है, ये झूठ बोल रहा है डॉक्टर से, और आपके पेशेंट भी झूठ बोलते हैं, ऐसा डेटा देते हैं. तो रिमेंबर द डेटा विच इज मोर डिस्पर्स्ड स्प्रेड इज नॉट ए गुड क्वालिटी डेटा, है ना. अब तुम भी जानते हो, रायता अगर फैला हुआ है तो कैसे खाओगे? बहुत दिक्कत होगी ना. So if the data is spread or the raita curd is spread, it's not a good thing. We want data or curd to be to the point. Less dispersion should be there. So lesser coefficient of variance, better quality data. Now, in confidence interval, how can you decrease this range? This was the question in NECT. How can you make the range small? To make the range small, sample size should increase. Sample size increase, confidence interval range decrease. Okay. More sample size, less confidence interval. Confidence interval decreases by increasing sample size. Is it clear to you or not clear to you, this line? Because it has been asked. Let me give you a small numerical example to make it more clear. Suppose I ask this question from first year student and post intern student, that how much marks you will get in your NEET exam. So the post intern said, I will get between 550 to 600 marks. And I am 95% sure about it. So this is the 95% confidence interval. Confidence interval is a very small thing. Confidence interval is simply that range of value within which answer lies. वो range जिसके अंदर answer छुपा है वो confidence interval है. And we keep talking in confidence interval. So here confidence interval is 550 to 600. If you ask the same question from first year student, how much you will get in your NEET exam, he will say, I am 95% sure I will get between 0 to 800 marks. 95% sure. So these are the two confidence interval. First is 0 to 800, second is 550 to 600. What do you think? Which one is more meaningful or significant? Of course, 550 to 600 is small confidence interval is more meaningful, more significant, because it is telling us that a student will get a good rank. First year student range 0 to 800, it is not giving us any idea whether he will pass or fail also. So this bigger confidence interval is useless. Smaller is more significant. Now, why post-intern confidence interval is smaller and more significant? Because post-intern had done many previous year question papers. So by doing multiple PYQs and CBOTs and GTs, he had increased the sample size of solving question. And due to solving question multiple times, now this student is more sure that he will get between 550 to 600. So by increasing sample size, by increasing your GTs and CBOTs and your practice papers, you become precise that this much will be my marks. But this first year, he had 0 sample size, not done any previous year question. That's why his range is big. So remember, sample size increases, confidence interval decreases. Very important area for an exam. Okay, now let's move to some other question. If this all concept is clear to you, this 4 coefficient is something which you should revise before every exam. This is so confusing, but if you revise this question, this part only, you will be able to answer this very easily. Okay. Now, the best indicator for routine monitoring of air pollution is sulfur dioxide should be there because it is the best chemical indicator. Then there is smoke and suspended particles, which is measured as air quality index. So the best answer is option A, of course. Okay. Smoke, suspended particle, and one more thing, to measure smoke and suspended particles, we use swelling index. So sometimes they ask, swelling index measure air pollution, soil pollution, or both? Answer is, swelling index only measure air pollution. It does not measure soil pollution. There is a special type of cloth which we keep at major areas and it absorbs the dust the whole day. Then in the evening we take out the cloth and measure the dust particle under infrared light. So the amount of dust will indicate air pollution and it will never tell about soil pollution. Okay. Now, a patient wants to know the study between smoking and lung cancer. So he collects data about people diseased with lung cancer. People diseased with lung cancer is mostly from government hospital. So he is getting hospital data. And along with hospital data, he collected data of sale of cigarette. So sale of cigarette will be taken from taxation department. So it is population data. And we have read it in our NEET PYQ discussion part 1 that whenever we take population and hospital data and try to correlate it, it is correlational study known as ecological study. Ecological has other name, correlational. And in ecological study, we ask question from no individual. Like here, in cross section, we ask it from every individual. Okay, so this is ecological for sure. Next question, Project Monica. What is that? Monica is multinational monitoring of trend and determinants for cardiovascular disease. ये जो नाम है ना मोनिका, ये जरूर किसी ठरकी ने लिखा होगा नाम, या तो कोई मोनिका का लवर ने ये नाम दिया होगा, बिकॉज ही टुक आउट मोनी फ्रॉम हेयर एंड का फ्रॉम हेयर एंड मेड इट मोनिका, है ना, मस्ट बी इन लव विथ मोनिका. So this will tell about cardiovascular disease. Now they can ask which type of study is Monica. So in Monica we are doing large cross population survey, and all the survey done in the population, they ask about present moment only. Do you have diabetes? Do you have hypertension? Do you smoke? Do you drink? Like that. So cross population survey is a type of cross sectional study. Cross sectional study is there. Okay, so this is cross sectional. But if they ask about question related to, let's say, the famous two trials, Doll and Hill and Framingham Heart study. In Framingham Heart study, the scientist kept on sending love letters to the doctors and kept on asking, do you have hypertension, diabetes and all, and do you smoke, drink or not? And he kept on doing it for 54 years in future. So Framingham Heart study is a very good example of cohort study, and similarly Doll and Hill study was done to know whether smoking cause cancer, and it also was a cohort study. So these are classical example of cohort study. Framingham Heart study tell about all the risk factor which cause heart attack, MI. Okay, chalo, very good. Augustine Oinam is saying nice handwriting, sir. I know you are being sarcastic with me. तुम मेरे टट्टी जैसी राइटिंग को अच्छा कह रहे हो, है ना. Sorry for this टट्टी writing. I will try to improve it from this moment. Try only. Okay, next question. Which of the following compound is predominantly responsible for disinfecting property of bleaching powder? We discussed it already. Hypochlorous, the one with a rus juice, will kill maximum bacteria. So HOCl minus, one with juice, kill 80 to 85% bacteria. Okay, so this is the hypochlorous acid. Acha, I hope you all know Horrocks apparatus is used to measure the chlorine demand of water, and the indicator in Horrocks apparatus is starch iodine, is the indicator of Horrocks apparatus. Okay. According to Sustainable Development Goal, ensure healthy life and promote. What is the target for MMR? Very simple to remember, 3 word, 70, 12, 25. 70 is the target of ratio, maternal mortality ratio. 12 is the target for neonatal death. Neonatal death should be less than 12 per 1000. MMR should be less than 70 per lakh, because MMR is measured in lakh. We have discussed the definition yesterday in our last session of PYQ first part. And 25 is the target, less than 25 per 1000 is the target for under 5 mortality rate. So it's very simple to remember. Under 5, 25. 5 into 5, 25. Half of 25, 12. And 70 for mother. So 70, 12, 25. 70, 12, 25. Do not forget it. Other than these 3 targets, you have to remember that premature, what? Not ejaculation. Cardiovascular death should be less than 1/3. Okay, and this all have to be achieved by 2030. Now the party of this SDG was ending and they all were high. So someone asked, sir, HIV, they said eliminate it. Malaria, eliminate it. TB, eliminate it. And don't come bothering us again and again. Just eliminate all neglected tropical disease by 2020. So this is one more target which you have to remember. HIV, TB, malaria should be 0, eliminated. By which time? 2030. Only one target is for 2020. Accident, road traffic accident should be reduced by half by 2020. And in 2020, Corona came. So accident actually became half. And all the leader of SDG said ki, dekha, bola tha na achieve kar lenge. I told you na we would achieve it. And you were telling ki we are high on alcohol. So remember, only one target was achieved, and that too only for 1 year. That is accidental death half. One target for 1 year. Rest, none of them has been achieved by now, and I hope it will not be achieved by 2030 also, but I wish it would be achieved. Chalo. So this is the target. Remember, infant mortality rate is not a target under SDG. IMR target is not there. Shruti is saying moe moe. Yes, dear. So the difference between the incidence of disease among exposed and incidence. When they say difference, we have discussed the formula yesterday. Difference means they are trying to know incidence of exposed minus incidence of non-exposed. And I hope you all remember it by our last session discussion of NEET PYQ, that this is the formula for attributable risk. Attributable risk. And if I change the word exposed on both the place with population, and I say incidence in population minus incidence in non-exposed by incidence in population multiplied by 100, then it will become formula for PAR. But in place of difference, if they have written by or divide, then it will become relative risk, because relative risk is incidence in exposed by incidence in non-exposed. Okay. And remember, relative risk is the best indicator of strength of association. Next question. The variation in data set. I told you, this question they keep repeating. Variation in data set is compared with that of another data set. Two data set, like the data of two patients whose morning erection history I was taking. When you want to compare between two data set, and that to dispersion or variation, which coefficient will you use? Coefficient of variance. This is coefficient of variation, COV, standard deviation by mean. Remember, variation in data set or quality of data set. If you have to compare quality of data set or variation in data set, we will use coefficient of variance. Okay. So that's why that discussion, which took us some time, was very important, because they ask a lot of questions from that discussion. Now let's move ahead. Pandemic that occurred in 2009 was H1N1, swine flu, sewer flu, sewerwa flu. That is H1N1 there. Vaccine protocol followed after disaster is D. Only the health worker are given cholera, typhoid, tetanus, toxoid. Do remember, after disaster, no vaccine is given to general people. No vaccine to general people. Why no vaccine is given to general people? Because vaccine give immunity after 3-4 months, and we have to focus on present management of disaster, not to worry about future. So what is the point of giving vaccine then? But there is an exception here, on which question has been already asked in one of the MCI exam, that measles vaccine is the exception to this. Measles vaccine induce immunity. Oh, I have to write better. Okay. Induce immunity in 7 to 8 days, but symptom come in 10 to 14 days. See, my writing is better. So, measles is the only vaccine which induce immunity before symptom. बीमारी के लक्षण आने से पहले हमारे अंदर मीजल वैक्सीन लेने से बीमारी के खिलाफ रोग प्रतिरोधक क्षमता पैदा हो जाती है, यानी सिपाही खड़े हो जाते हैं. तो एटलीस्ट वी कैन गिव मीजल्स बिकॉज इट इज इंड्यूसिंग इम्यूनिटी बिफोर सिम्टम. बट डू रिमेंबर, measles vaccine also not given during disaster, also not given post disaster. Why it is also not given post disaster? Because it is written not only in PARC but in CDC and WHO guideline also, this line, and you have to remember this line, only these three given. Why measles is not given? Because first thing is, measles is not a major disease which occur during disaster. Most common disaster is flood, hydrological disaster under which flood come. And in flood, what is the most common disease? Most common disease during flood or disaster is chharchari, gastroenteritis. Chharchari is the musical sound which comes out when you have loose motion. Chharchari. So gastroenteritis or chharchari is the most common disease during flood. Then the second common disease can be rickettsial diseases, leptospirosis, cholera, and then some mosquito transmitted disease can be there. So measles is not a common disease, so why to vaccinate? First reason. Second reason, doctor and nurses are always in limited number in disaster time. So if we will engage them in vaccination, who will save the life? And third reason, it is difficult to maintain sterile condition during disaster. So due to these three reasons, measles is also not given, only these three given, and that too only to doctor or health workers. Very commonly asked question, so do remember it. Pradyuman is asking, but COVID mein vaccine to di gayi thi, sir. In COVID, we had given vaccine during the wave, during the disaster, which was a totally wrong decision. And you have also seen that a lot of death has occurred in 2021 during May, June, July. Vaccination of COVID was done and there were a lot of death. You must have read the reports of death. My mami ji also took vaccine and then she was in the ICU for 10 days. And after, when she come out from the ICU, before going to ICU, she was fat like this. After coming to ICU, she was thin like this. My mama was really happy after looking that transformation. But you understand the point. There was a lot of problem in people after receiving vaccine during disaster wave. Why? Because corona induced hyperimmunity. That is the major problem which occur with corona. That's why the treatment is with steroid, which reduces the immune system activity. So corona is stimulating the immune system very high. Vaccine is also stimulating it very high. So if a person is taken vaccine and then after vaccination he develop corona fever, immune system will go so hyperstimulation that patient can have heart attack, can die. And that's why there were death. The same COVID vaccine when taken in the month of November, December in 2021, there were no death reported because then the wave was down. So it was a disastrous decision by the government to give vaccine during corona wave. And now you may ask why the government then did it? Because government was unable to do any other thing. Since 2020 the wave was there, but government was focusing on issues like people from Nizamuddin Dargah are spreading it, and they were not focusing on increasing hospital bed, doctor, nurses, or preparing oxygen plant. So in 2021 when death started occurring, we were totally unprepared, and government, to sift the story, they started doing vaccination, which caused more death. 10 death was reported by Government of India to WHO also, and there were report of 374 death in paper, and one of my friend has newspaper cutting of all those 374 death. You know? So of course COVID vaccination was also disastrous, and you understand how one PSM decision can affect the whole country. You know? So that was a wrong decision example. Now let's come here. Roshan Kumar is very correct in answering. He's saying that most common complication or problem is the myocardial infarction. And this question has been asked, what is the most common complication after COVID vaccination or after COVID infection? Answer is that thromboembolic side effect. The thrombus formation embolic side effect is the most common complications. Okay. Now come here. What is the correlation coefficient less than 0.5? We have, remember, less than 0.5 means weak correlation. In fact, 0.1 to 0.3 is weak. 0.4 to 0.7 is moderate. So moderate is not given in the option. That's why we can answer weak. If moderate is given, that will be much better answer. So correct answer is moderate, not in the option. So we will answer weak. Strong will be there if it is 0.8 to 1. We have discussed it. Not statistically significant will be there if it is more than 1 or less than -1, and like 1.2 or something, it is not statistically significant. Okay. Chalo. Next question. A study was undertaken to find the relationship between the same question, COPD, and they collected the patient from hospital data, taxation, so it was ecological. What do you mean by posological study? Posological means drug dosing in children. Like, I hope you know, we give paracetamol and amoxicillin 50 to 100 mg per kg per day to children. So this type of drug decision, how much, like azithromycin, we give 10 mg per kg per day to children. So drug dosing study is posological. Okay. Which of the following is category A? Very commonly asked. A for anthrax. Not given. Bacillus anthracis. So anthrax A. Second thing in A is botulinum. Botulinum. So two are there. Anthrax, botulinum. Then two old diseases are also category A. What are those two? Yellow. No, not yellow. Sorry. Two old disease which are also category A are plague and smallpox. Old disease. So this is number 3 disease, 4 disease. Then the two disease which are viral hemorrhagic fever are Ebola, Conbola, Ebola and Marburg. Both of these are also caused by eating meat of fruit bat and then transmitted by patient body fluid, and patient died due to internal bleeding in these disease mostly. The last 7th is tularemia. Tularemia. Okay, so total 7 diseases are in category A. Very easy to remember. Anthrax, botulinum, 2 old disease, smallpox, plague, 2 viral hemorrhagic fever, Ebola, Marburg, and tularemia is disturbing the flow. Yahi bhadwa hai. It is disturbing the flow. Tularemia. It's 7. Okay, so these are category A, which are extremely infectious, extremely dangerous and infectious. Now, they can ask from category C because they are newer agent, and in newer agent only 2 come, Nipah and Hanta. Hanta is transmitted by rat, and for Nipah they asked one in INICET exam one very good question where they had made a date palm tree, some fruit bat was flowing around that, and there was pig also standing or roaming around. So remember, Nipah is transmitted by date palm sap and through pig, Hanta by rat. Now when it comes to category B have some example which they very rarely ask, but still just for the revision, brucellosis, staphylococcal toxin, and anything can come. So we should be ready. Ricin toxin, okay, brucellosis, staphylococcal, ricin toxin, and psittacosis are category B. Psittacosis are with bird dropping. चिड़िया इतना छोटा हगती हैं कि उनके हगने को हम ड्रॉपिंग कहते हैं. We call bird sit as dropping. लेकिन जब गीला गीला आके सर पे कंधे पे फटता है तब पता चलता है ये कितना बड़ा था, है ना. Only when the wet bomb come and explode on us, then we realize the real magnum of their sitting potential. So this is due to bird dropping, psittacosis. So these 4 are in category B. I hope you will remember the 3 categories. Now let's move ahead. What is radiation dose monitoring in occupational worker is done by TLD badge, thermoluminescent dosimeter. How you know it? See, you can see this study which is there. It is saying this directly, that determination of radiation dose, should I make it more better? Determination of radiation dose involve use of individual personal monitoring device like TLD badge or pocket dosimeter. So TLD badge and pocket dosimeter are mostly used to measure radiation dose. Pocket dosimeter are not in option, so answer will be thermoluminescent dosimeter. So this can be roughly the same thing also. It can be badges, TLD badges, or dosimeter which are small and carried in the pocket. So do remember this answer. Now coming to this 2021's question. Which of the following thermometer measure low air velocity rather than cooling power? Answer is Kata thermometer. I hope you all have seen the image. Kata is long like this with fluid in it like this. Kata measure both the thing, air velocity, cooling power, but nowadays it is more used for low air velocity. Previously it was used for cooling power. Globe thermometer will have black color globe, the best globe of the world without any boundary. So if it is circular, it is globe thermometer. If it is longer, elongated, it is Kata. Image based question has been asked from this part. So do remember, this is Kata, this is globe. And globe can observe the radiation of the room, so it will measure radiation temperature. Now, wet globe thermometer. This is one question of our time, very common question. Wet globe or wet bulb. This they used to ask. Wet bulb and dry bulb thermometer. What does they measure? So wet bulb and dry bulb, they are both in sling psychrometer. And psychro word means humidity. So all these three things will measure air humidity. And a sling, there is a handle, and then this wet bulb, dry bulb is on the instrument which rotate in the room like this. Sling, like a sling. So they call it sling psychrometer. It measures, of course, radiation, air humidity. Last thing you have is Assman psychrometer. Assman. It looks like a rocket which will go in sky. Assman psychrometer. And again you can see Assman is there and psychro word is there. So psychro will measure what? Again the same. Whenever psychro word is there, it will measure air humidity. Anyway, my name is also Ashwani. Ashwani. Now from Ash, I remember one more question. They have asked it from hepatitis B. That hepatitis B is a recombinant vaccine, and in that recombinant vaccine, hepatitis B, which component we use? Hepatitis B, which component we use? Is it HBeAg, HBCAg, or HBsAg? So in the hepatitis B vaccine, they use HBsAg. S. Always remember the SAG. क्योंकि baby को base पसंद है, and then there is DNA. Okay, so do remember the S. Okay. Now, Jimmy Jaipur Jackson and Kolkata से आया मेरा दोस्त. Name of a doctor who is replying. They are fighting on one thing, that ASA is 8th pass or 10th pass. I have this one question on it, in which I have put the picture from the Park textbook, and it is written 3 places in Park that ASA is minimum qualification is 8th class pass. Age 25-45, 8th pass, not 10th pass. And it is just one clip I am showing you, but it is written in 3 places in the recent 27th edition of Park. No matter which teacher or which expert, including me, teaches you, always trust evidence. Do not trust expert, because expert can be biased, expert can be manipulated or can manipulate you. So why the teachers are teaching that 10th pass is the criteria? Because if you will Google it, 10th will come. 10th is the desired, we want 10th pass ASA. But the reality is many Harjan Mohalla, I hope you know, that separate area of the village where people from oppressed community are forced to live together. And tribal areas and Harjan Mohalla, slum areas, they don't have even 5th class pass female sometime. So if you will put high criteria, you will not get the representation from those areas who need ASA the most. So remember this point, 8th pass is the minimum criteria, and there is only one ASA for 1000 population. And there was a mistake by one teacher who said 2 ASA per 1000. That was also wrong. 1 ASA per 1000, 8th pass is the criteria. 3 places it is written. If an examiner has to set question, I will not Google it and then ask it from you. I will ask the question as a line from the Park. A lot of questions come directly from Park, and always trust evidence, never trust expert. Do not even trust me. Trust the evidence, it is 8th pass. Don't go into the debate, answer is 8th pass. Okay, chalo. Now let's come back. I forgot where I was, but I hope my pen marking will tell me where I was. Yes, so I was here. In the thermometer, in my ass, I was there. So the ass thing is done. I hope you will remember. This 4 instrument, very frequently asked. Okay, that is there. Jimmy, I hope it is clear now. 1 per 1000, not 2 per 1000. Okay, and Jimmy Jaipur Jackson was absolutely right. Minimum is 8th pass. We prefer 10th pass, but in exam they only ask minimum, and minimum is 8th pass. Chalo. Nadir is saying everyone else bring evidence. Yes, dear, every teacher can bring evidence, but the evidence which is coming from Google or Wikipedia is not an reliable evidence. Park is a reliable evidence. And suno sabki karo apne man ki. You have to write whatever you think, right? And it's my evidence. If you want to trust it, or bhaad mein jaye. Okay, so I am just giving the point from Park, and I hope you will lose a mark if you will answer 10th. Okay, now come here. There is an outbreak of buboes. What does bubo means? Bubo means lymph node. Buboes in the community. Who is the causative organism? Buboes means there is bubonic plague. Bubonic plague, hymenoplesis, and endemic typhus, which is also known as murine typhus. These four diseases are transmitted by rat flea. You can remember it by the mnemonic Bhem, Chota Bheem. You know na, Chota Bheem is our local hero. Chota Bheem, Chota Bheem, Chota Bheem, Bheem, Bheem. So imagine that on the rat flea, Chota Bheem is sitting with a gada in his hand, and that Chota Bheem rat flea is transmitting this, and Bheem is the mnemonic to remember the disease. Why I made Chota Bheem as the mnemonic? Because there are two types of typhus, endemic and epidemic. Epidemic is transmitted by Prowazaki, power. Epidemic typhus transmit louse. Louse is the transmitting agent. Causative organism is Rickettsia prowazaki. In many exams, they will create this question that after bite, a patient have rash, fever. What is the causative organism? In 99% time, the causative organism is epidemic typhus. Do you remember it, my friend? Very common question. And they ask who is the causative organism? Rickettsia prowazaki. Who transmit it? Louse, power, epidemic. But endemic, just like Chota Bheem, who is endemic to India, local hero. Endemic typhus, Chota Bheem, rat flea. So this is the transmitting agent. But who caused bubonic plague? Of course, Chenophycelia cheopis is the other name of, this is the other name of rat flea. So Chenophycelia cheopis is the transmitting agent vector. But who is the causative organism? Causative organism is Yersinia pestis. So Yersinia pestis cause it, and Chenophycelia cheopis transmit it. Okay. Chalo, now let's move ahead. Very good. Chutki bhi yaad aaya, Dr. Morphine. Oh, naughty boy. You remember Bheem, Chutki both. Chalo. And now let's move ahead. Acha, this is a controversial question. In the Kerala district, after flood, government distributed doxycycline tablet. Why? Because doxycycline was given for chemoprophylaxis of leptospirosis. Okay. Now, I hope you all know that in the life cycle of leptospirosis, there is rat urine or cattle urine, which then go to human and then transmit it. So for leptospirosis and cholera, both, the drug of choice is doxycycline, 100 mg, 3 times a day for 3 days. And rat urine is transmitting it. So government is distributing leptospirosis drug. What is the second thing they will distribute? So second thing should be something which will kill the rat. And the rat poison is zinc phosphide, which will kill the rat. This is the rat poison. It is extremely toxic, yellow color of rat poison. Extremely toxic is red color. Extremely toxic. This is the logo of extremely toxic rat poison. Extremely toxic rat poison. Okay. Now, yellow color, sometimes this symbol you can see somewhere on insecticides and all. Yellow color is for highly toxic, like indosulfan. So they usually ask, they have asked it this question one time. Yellow is for highly or moderate. People think red is for highly, so yellow will be moderate. No. Red is extreme, yellow is highly toxic, indosulfan. Now, some platform, they have said that the answer to this question will be malathion, because malathion is used to kill mosquitoes, and mosquito transmitted disease can be there after flood. I agree with them that malathion can kill mosquito, but here they are talking about leptospirosis specifically, and leptospirosis have rat urine as in their cycle. Rat is the causative transmitting part. Rat is there. So they are not talking about general management of flood. If they ask general management of flood, we can use malathion. But they are asking that case of management of flood in which leptospirosis is occurring, in which rat is involved. So the answer should be zinc phosphide, not malathion. And on the platforms where it has been discussed, they have written in the explanation also that we need to kill the rat. Rat insecticide should be used. So of course, we will be able to kill rat only by zinc phosphide, not by malathion. That's why definitely the correct answer will be zinc phosphide. I know this is controversial. You can decide by your own, but answer will be zinc phosphide. I think so. And there is a evidence which, there is a logic which say that zinc phosphide should be there. Now, the trauma classification of triage we will discuss in our some other question again. And of course, yellow is for moderate thing we use yellow. Yellow is for those who need surgery in 6 to 24 hours. So they call it moderate, or sometimes they use the word relatively stable. So whenever it is relatively stable or moderately life lethal, then it will become yellow. Okay, 6 to 24 hour surgery is needed, or they can have severe complications. Okay, now come to the next question. Following admission of road traffic accident, there is a spillage of blood on the hospital floor. Which disinfectant will you use to clean the floor? Sodium hypochlorite. In one of the exam, they ask what is the percentage of it. 1% is used to clean the floor. 0.5% will be used to wipe the surface of COVID-19 patient or any infected patient ward. If you want to wipe the surface, doorknob and other thing, we will use 0.5%. Blood spillage, 1% sodium hypochlorite you will pour on it. And then you will try to wipe it. Now this is about air quality index, and they have asked that on November 23. So if you look at November 23 only data, the air quality index is 407. And the method to remember air quality index classification is that up to 100 it is okay, less than 50 AQI is good. Good quality air, अच्छी हवा छोड़ी. 51 to 100 satisfactory. मजा नहीं आया, लेकिन सूंघ के आपकी छोड़ी हुई हवा satisfaction हो गया. तो up to 100 things are good. Then you have to remember it with the mnemonic moderate, poor, very poor, severe. MPVS is the mnemonic. Moderate is used for 101 to 200 air quality index. Poor is used for 201 to 300. Very poor is used for 301 to 400. And severe is used for more than 400. So here it is more than 400. That's why it is severe. Do remember the mnemonic MPVS and this classification. कोलकाता से आया मेरा दोस्त पूछ रहा है, आप तो दिल्ली में हो, एयर क्वालिटी इंडेक्स अभी कैसा है? लेट मी स्मेल एंड टेल यू द एयर क्वालिटी इंडेक्स. I think the air quality index in Delhi right now is around 230. But we can always check it on Google. What is the air quality index of my area? AQI, Gotham City, Gotham Nagar or Hoj Khas, whatever you say. AQI, Indian Air Quality Index. Yeah, this is telling us the news. Right now, this air quality index is coming around real-time air quality index. I will have to search. It is 133 only. 133 means which category Delhi is right now? Moderate. And I said 230. I was 100 expecting 100 more particulate matter concentration AQI. And that is why they tested with machine. If my nose can tell it correctly, they will put a bamboo in my bum and they will hang me on some main area that Mote keep breathing and keep telling AQI. We cannot tell it personally. We need the device to measure it. So it is right now only moderate and it's a good thing for people like us. And post Deepavali, sometime it go more than 500-600 also. Now there is an outbreak of acute encephalitis in the community. This is again one controversial thing, and which is true for the vaccine which is given. Now for Japanese encephalitis, there are two vaccines. Actually, there are three vaccines. If you look at the Park textbook, recent edition again. One is the cell culture vaccine of Beijing. Other is the mouse brain derived vaccine, which is Nakayama. Okay, or Beijing strain. So this Nakayama or Beijing strain, this is something which we don't use in our national immunization program. You can remember it like this: Nakayama is Nakamyab. So this brain derived vaccine or killed vaccine is given intramuscular route, but it is not given in our national immunization schedule. Not given in national immunization schedule. What is the thing which we give? We give SA14-14-2 strain of JE virus, which is live attenuated vaccine. And this was the question in NEET exam also. I am telling the PYQ of NEET only, but recent exams also, that what is the route of giving JE vaccine? So route of JE and MR both are subcutaneous, because in India we are giving live vaccine. So live JE and MR are subcutaneous. Now they can further complicate this question and they can ask which is given in which arm. So remember, MR is given in right arm subcutaneously. Both are given 0.5 ml. And JE is given in left arm. How will you remember it? M for mother. And mother is always right. And not always, but you understand the point. Mother love is always right love. Okay? So mother right. MR right. And remember, in MR the diluent is sterile water like mother love. And JE the diluent is phosphate buffer solution. So now let me explain this point further. What they are asking in this question is that there is outbreak of acute encephalitis. Epidemic is there. And again, Park textbook has gone a bit further and they have said that when immunizing children 1 to 3 years with mouse brain derived vaccine, that means the Nakayama one, we give 2 doses and then 1 booster. Of course, you know this is not the schedule of JE. We are not giving the killed one. And they have given this one thing here, that this vaccine, the mouse derived vaccine, the killed Nakayama one, this vaccine is best used in inter-epidemic period. That means the killed one is not used during epidemic. It is used between epidemic, when there is no epidemic. Inter-epidemic means between epidemic. Now again, further they helped us with writing this line, that equally good childhood protection is obtained by single dose of live attenuated vaccine whose strain is SA14-14-2 14 2 bar. Okay, now followed by a single booster at an interval of about 1 year, which we give right now. At 9 month and 18 month, 16 to 24 month, we give it 2 doses, 1 and then booster. Now they have written it, you can see. This vaccine, that means SA14-14-2 in India, is an integral part of universal immunization program in 83 districts. So in India, you can see clearly we are not giving Nakayama or killed one anyway. So writing killed and IM is the route of giving it is totally obsolete. There is no, this is recent update thing is not applying here. This is the national immunization schedule thing. And they have written that the killed one is not during epidemic, it is inter-epidemic. So the correct answer is definitely the live one, which is given subcutaneous. Okay. Please don't doubt it and do rely on it. And do remember, JE is given in left arm. The diluent is phosphate buffer solution and it is given subcutaneously. It is 0.5 ml. It is live, which is given. Strain is SA14-14-2. Okay. चलो सर एक शायरी सुना दो प्लीज, कोलकाता से आया मेरा दोस्त बोल रहा है. क्यों नहीं मेरे दोस्त, मेरी एक फेवरेट शायरी में से है. कि गिरते हैं सैर सवार ही मैदान जंग में, सॉरी मेरी उर्दू थोड़ी खराब है बट फिर भी, गिरते हैं सैर सवार ही मैदान जंग में, वो तिफल क्या गिरेंगे जो घुटनों के बल चला करते हैं। व्हाट डज इट मीन? इट मीन्स दोज हु फाइट कैन ओनली फॉल इन द बैटल ग्राउंड, दोज हु आर ऑलरेडी ऑन देयर नी, तिफल मीन्स बच्चे छोटे से जो घुटने पे चलते हैं, those who are already on their knee, how can they fall? What does it mean? It means if you are preparing for an exam, or if you are preparing to propose a girl or do something daring, at least try and do it. If you surrender before proposing, if you surrender before exam, you will never fall, you will never have good memories also. So always take the risk. Go and explain it to the girl that you like her. Go and give the exam with full confidence. Never surrender before battle. Don't walk on your knee. Okay, walk straight. Okay, fight the battle. There is nothing like losing the battle. You only learn from the battle, and I think so. चलो now. शुक्रिया 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 हौसला अफजाई के लिए, वाह वाह वाह, शुक्रिया शुक्रिया। चलो now come here. Evaluation based on treatment given to the patient and their clinical management in healthcare facility is based on process. See, there is input, process and outcome. Three type of things which we can evaluate during any surgery, during any clinical process. Input means what are the doctors which are there, that means human, what are the money which is there invested, what are the instrument which are there, that are input. Process means how they are doing it, and that's what they have written. Treatment given. So treatment given come under process, work done. Outcome means survival or death, or improvement of life quality. So here they are talking about the process. That's why it is process indicator. And do remember, if they ask what is the method to compare end result, end result is compared by which of the following? Option A, is it compared by monitoring? Let me see whether you can answer it or not. Option B, is it compared by evaluation? This is again a PYQ. Option C, is it compared by surveillance? So how we compare end result? Monitoring is day to day looking over activity. Okay, like for example, suppose you are in a relationship and every night or evening whenever you meet your boyfriend or girlfriend, he or she secretly take your phone when you are in the toilet and check that in the day have you sent messages on Instagram, have you downloaded Tinder or sent something in Tinder and all those things. So that is monitoring, day to day follow up. Surveillance means close monitoring and feedback is given. Feedback is given for improvement. Surveillance means your password of Instagram and any other app is already with your girlfriend or already with your boyfriend. So whenever you ping, she need not to check your phone. She already know that you have sent the message on Instagram or Facebook or something. And I have seen many couples like that. Even my Gmail ID is with my wife, only Gmail ID, because I don't have Insta on my phone and all. So you understand the thing. That is surveillance. Evaluation compare end result. Evaluation means you meet your boyfriend, girlfriend once in 3 months or 1 month. Your boyfriend or girlfriend take your phone and check out all the things which you have done in last 1-3 months. That is evaluation, comparing end result. So end result is by evaluation. Okay, not surveillance, evaluation. Okay, that was a confusing question. A lot of you have answered surveillance as answer. Answer is evaluation, B option. Yeah. And none of you have answered B. That means it was confusing, and that means you learned something new. So you should be happy by giving wrong answer in the class, because nothing is wrong in the class. You are only learning. Chalo. Now coming to next question. A girl child has recurrent yeast infection, respiratory virus infection since she was 3 months old. Which of the following is contraindicated? All the live vaccine are contraindicated. And remember, we have discussed the way to remember all the live vaccine. CPP, IJO. These are the 5 vaccines which are both live and killed. Cholera, plague, polio, JE, and I for I for influenza, and J for JE. So these 5 are both live and killed. Along with this, there is BCG, MMR, varicella, BMV, and then rotavirus and yellow fever. Okay, तो CP पे आ जाओ ना यार, BMV चलाएंगे यार, like that BMW चलाएंगे, but W is not there, है ना? Anyway, so do remember these 10 are live vaccine. Live vaccine is not given in immunocompromised, pregnant mother, and infant. In infant we can give, but immunocompromised and pregnant female we don't give it. But in pregnancy, yellow can be given, and the safety from yellow, if you took yellow vaccine once, it will give lifelong protection. Again, one PYQ being already asked. So here we cannot give MMR because MMR you can see is a live vaccine. Okay. Which of the following is conditioning influence for malnutrition? Of course, when you have infectious disease, you are conditioned. Conditioned मतलब आप तैयार हो रहे हो कुपोषित होने के लिए. If you have infectious disease, you are getting prepared for it, for the malnutrition. So that is infectious disease. Okay. Which of the following is not a component of global hunger index? Do remember, infant mortality rate is not a component. In global hunger index, we have these. Actually, there are 4 components which are there. Under 5 mortality is one component. Percentage of undernourished population is one more component. Percentage of undernourished children under 5 years is third. But if this undernourished have 2 things, stunted and wasted. Remember, wasted is having less weight for height. Stunted is having less height for age. And wasting is indicating acute or chronic. Less weight for height is acute malnutrition. Very commonly asked question. Acute malnutrition is less weight for height. इसका मतलब लंबा तो हो गया है लेकिन सूख गया है. Getting good nutrition since childhood, so there is no chronic malnutrition. But now due to breakup or some reason, some infection, the child is not eating for last 1-2 months. So that is acute malnutrition. And of course, less height for it is chronic malnutrition. Chronic malnutrition is this and acute is that. Now, do remember the criteria for severe acute malnutrition. In severe acute malnutrition, we measure weight for height less than 3 standard deviation. Second thing for SAM is mid-arm circumference less than 11.5 centimeter will have red category, and that is severe acute malnutrition. Third point for SAM is visible wasting or edema. Visual wasting or pitting edema. So if these 3 are there, it is severe acute malnutrition. Very common question for PSM and of course pediatrics both. So do remember this criteria. Okay, Saif Ali Khan, my father of my illegitimate child, is here. Good afternoon, my dear friend. Saif Ali is asking, could you explain tetanus vaccine? Hey, my dear, you have to watch the video starting 5 minutes and you will learn everything about tetanus vaccine. So you are irresponsible, and just like you did not use condom while having sex with me, here again you came late, and just like you come late while having sex also. So you are going to miss it. Please, dear, watch the first 10 minutes. Let's move to next question. Okay. Now, a researcher want to know whether there is an association of CRP value with risk of MI. And you can see here, the CRP value is increasing. Here the CRP value is 0.121. Here it is 2, here it is 3, here it is 4. And with increasing CRP, C-reactive protein, relative risk of MI is also increasing. 1.3, 1.7, 2.1, increasing MI also. So both are increasing together. It's like this thing, CRP and MI, both are increasing together. There is a direct correlation between them. So what does it mean? If there is a direct correlation, writing no association will be wrong now. Because you can see there is a direct correlation, direct positive correlation. They are going together in increasing way. So no association is wrong. CRP decreases the risk will be wrong. One is increasing, other will also increase. That means correct option is B. Increase CRP increases the risk. Okay. But can I say that high CRP is the reason for MI? High CRP is causing MI? We should never say like that. Remember, some of the students say while recalling this question was that one option was high CRP cause MI. This statement is totally wrong. If two things are happening together, it does not mean that one is causing other. This again, one question was there on this language. Let me write this thing. Correlation does not imply causation. If two things are happening together, it does not mean one is causing other. Okay. For example, in India, COVID vaccination rate is increasing and cases are coming down. So these are negatively correlated, and government is saying cases are coming down due to vaccination. But there are 5 countries in which there was more than 90% vaccination, still second wave of COVID came, which include US, UK, Israel, Seychelles and China. So though all these 5 countries prove that cases are not coming down due to vaccination. So if two things are happening together, it does not mean one is causing other. Correlation does not imply causation. Saying high CRP cause MI will be wrong. Saying that one increase, other will increase, that can be correct. Okay, so B is correct. Okay, this is 2-3 question which we did in one question. Do remember it. A child presented with pharyngitis. A throat swab was obtained. Of course, the swab is a swelled waist and it will goes in yellow category. We have done it in detail, all the BMWs. Now, which of the following is the SI unit for the measurement of brightness of light? Answer is candela. Brightness of light is also written as luminous intensity. And we all know candela bring the light brightness. So candela for brightness. 2 more they can ask, 2 more things from here to remember. Illuminance. Illuminance means light falling on a surface. What is luminous intensity means? Light coming from a point source. Light from a point source. And of course, point source can be candle. So from the candle, light is coming, brightness is coming, luminous intensity is coming. Light falling on a surface is illuminance. And the unit of this is lux. So if you went to a party and suppose the guy tried to flirt with you and said, today you are illuminating, it means the guy is not appreciating you. It means the guy is saying that the room has good brightness. Good light is falling on your face. That is illuminance, unit is lux. And then there is luminance. Luminance means light reflected from a surface. Luminance. Reflected from a surface. Now, sorry for my tutty writing again. Light reflected from a surface is luminance and its unit is Lambert. Lambert. Now, how to remember it? A guy in Mumbai, Naveen was his name, he suggested me a very good mnemonic to remember it. That sir, in Lux ad na, you have seen na, sometime they put Ashwani Ranjan, sometime they put Kareena Kapoor, and one time they have also put Shahrukh Khan in the ad of Lux in a bathtub. You know? So in the Lux ad, they are doing ilu ilu. Ilu ilu means I love you, I love you. So Lux ilu ilu, okay? Lux illuminance. Then to remember luminance causing Lambert, there was a guy in Bangalore, I'm missing his name, Umar, I think. He said this mnemonic, sir, you can remember it like this, Lamba lamb. Lamb means, you know, na? Child of ship. Lamba lamb. So luminance, Lambert, Lamba lamb. Ilu ilu in Lux ad. And light is coming from candle. So brightness, candela. Do remember these 3. Okay. Don't forget, Lamba lamb. Okay. A pregnant woman whose niece lives with her in the same house contracted varicella. They were not lesbian. They were just living together. C tested negative for serum antibody against varicella. So if someone is negative for antibody, it means they can acquire the infection. That means they are susceptible to chicken pox. Of course, they are talking about varicella, means chicken pox, not zoster. If they said that antibody present, if they say antibody present for varicella, then answer will be definitely that C is immune to chicken pox. But here antibody is absent, negative, so C is susceptible. Quite a lollipop question. Next question. Sir, school health program is managed by which of the following? Primary Health Center and Ayushman Bharat. Both of it are managing, are looking for a school health program. In a school health program, a school teacher, they get 1 day training at PHC, and then after getting 1 day training, he screen all the student for visual acuity. If visual acuity is less than 6/9, child is referred to higher center for further treatment. And in a school health program, one new thing is happening, Health and Wellness Day. I am expecting this question in this exam. Health and Wellness Day will be celebrated on every Tuesday. On this day, what will happen is that there will be messenger of health and wellness messenger, which will be boys and girls, and there will be male and female teacher, which will be ambassador of health and wellness. Health and wellness ambassador will be teachers, male and female teacher. And no, they will not do couple dance. They will motivate student for yoga and meditation. Kyunki yoga se hoga. So this is a new thing which is happening there. Do remember the area is 10 square feet. There is a minus desk in school health program. Every student, every class has 40 student. One urinal is for 60 student, and if you mix student with urinal, it will become 40. So 100 is for latrine. 25% area of the class should be door and window, and light should come from left side of the class. A man from Chhattisgarh presented with progressive muscular weakness, leg spasm, pure motor paralysis. He is a case of neuroletharism, and neuroletharism is due to eating khesari dal, Lathyrus sativus. It is leading to neuroletharism. So that is the answer. Now, do remember two important things in neuroletharism, which I hope you already know. BOA, beta-oxalyl aminoallyl is the poison, and they can give you the hint that patients are walking on toes with cross-legged. And this was again asked in NEET 2023, cross-leg walking on toe. So that is also suggests neuroletharism due to khesari dal, khesari pulse. And what is the treatment which we give? The treatment is vitamin C, 500 to 1000 milligram for the treatment. So do remember the poison, the treatment, the symptom, and the adulterant khesari dal. Okay. Now, a 10-year-old girl, in the exam, if they give two options, suppose one option is TT, one option is DT. What will be your correct answer? TT or DT? The correct answer will always be DT. Of course, here TT and DT both are in the option. So, of course, if DT is not given, then TT can be correct. But what vaccine which we give at 10 year and 16 year? And of course, during pregnancy also 2 DT is given. But 2 DT is given in pregnancy if last pregnancy occur in more than 3 years back. If last pregnancy occur within 3 years, then only one booster DT is given to pregnant mother. Okay. An Anganwadi worker take measurement of weight and height of the child. Height for age in the child is less than -2. We just discussed height for age is less. It means the child has not eaten well when he was small. That's why the child height is less. So it indicate chronic malnutrition, height for age. Okay. If it is low weight for height, acute malnutrition. If it is low weight for age indicate both acute and or chronic malnutrition. What does it mean? See, imagine me as a malnourished child. I am so dried up. So I can be malnourished due to 2 reasons. One reason is that my mother has not given me food since my childbirth. That is a chronic reason. Second is, since my marriage, my wife is keeping me hungry. That is acute. So I can have low weight due to any of the two reasons, acute or chronic. And so you understand, acute or chronic. And it can be possible that my mother and wife are planning together to keep me hungry. So they can be together, or any one of them can cause low weight for age. So low weight for age, both chronic is height for age, acute is weight for height, wasting. Do remember this. International Food Policy is talking about Global Hunger Index. So it is a repeat question. And we already know that we measure undernourished population, we measure under weight population, children, but not infant mortality rate. So IMR is not used in the calculation. Okay, culture plate, the question which I was talking about. Culture plate and medium, both of them clearly written in PARC that they both will go in yellow bag. This is controversial, but I have shown you the table in the initial 10 minutes of the discussion. It is there. Yellow, it is written in PARC, so it is yellow. Now, the average life expectancy of a woman in Japan is 87 due to recent advance in testing for cervical cancer. Increase in life expectancy is there. This is known as QALY. QALY means, if you write the full form, it is quality adjusted life year. But in all the full form, just adjust the word adjusted. Adjusted should be removed. And the meaning of QALY will come clear. Meaning is quality life year added due to an intervention. Added due to something, an intervention. Intervention means जो भी आप उंगली करते हो, कुछ नई दवा देते हो, कुछ नई चीज करते हो, anything you do from your side is an intervention. And here it is written, testing for cervical cancer increase the life. So that's why the answer will be QALY. Now, what is HEL? HEL full form is health adjusted life expectancy. But again, you have to adjust the word A and you will get the meaning. So HEL stand for healthy life expectancy. This is something which is estimated at birth. When the child is born, then we estimate how long that child will live. Okay, that is HEL. DFLE is nothing. DALY, I hope you all know, stand for disability life year. And DALY has two components. One is years of life lived with disability. Second is years of life lost due to early death. Okay. For example, let me give you a story to that. Indian are expected to live 68 years. This is our average life expectancy. Suppose an Indian died at 62 years and last 10 years he lived with hemiparesis. He had hemiparesis. Okay. So can you find the DALY for this person? How will you find the DALY for this person? First thing is year of life lived with disability. How long he lived with hemiparesis? 10 years. Second component is year of life lost due to early death. His expectation was 68, he lived till 62. So 68 minus 62 will be 6 years. So total DALY will be 16 years. Okay. Let me calculate it here. DALY has two components. Year of life lived with disability, and for 10 years he was with hemiparesis. It is also having year of life lost due to early death. So 68 was the expectation and he died at 62. So he lost 6 years. So total 16 years will be the DALY. Okay. And this is actually the story of my father. When I was in second year of MBBS, he had hemiparesis and then he died 5 years back at the age of 62 years. And you can see I'm not so sad while talking about my father's death, because being a father myself, I realized that parents only want happiness of their children. So even if my father is not there, he must be expecting that I am happy. So don't forget this. If you look at the heart of your parent, they only want your happiness. Okay. Now, DALY is this, but this part, year of life lost due to premature death, early death or premature death, is also known as PYLL, year of life lost due to premature death. We will talk about it in separate question. And there is one last component which we want to talk from here, that is Sullivan index. Sullivan index means life expectancy minus DALY. Sullivan index tells us how many years a person live without any problem, without disability. Okay. For example, in my father's story, life expectancy was 68 years, DALY was 16. So Sullivan index will come 52 years. Until 52 years, my father was all right. Of course, he have hypertension, but he was not suffering from some serious disabilities. So till 52 years, he lived without disability. That is Sullivan index. Okay, dear. So Sullivan index is estimated at death. HEL is estimated at birth. DALY has two components, and QALY you add due to some intervention. So here the answer will be QALY because we are doing intervention. This is again a very important page. Very confusing question come from it. If you revise this page before exam, it will really help you in preventing you from doing this silly mistake in this topic. Do revise it before exam. Now, Saif Ali Khan, father of my illegitimate pregnancy, is asking, burden of disease is best estimated by? Answer is DALY. DALY will best tell about burden of disease. DALY best tell about burden of disease. And you understand the use of DALY now. If you want to get fund for hemiparesis patient or mental health patient which suffer a lot but do not die, you need to express the burden in terms of DALY. Chalo. Now, here, if you are in a disaster affected area, which work you will do? Of course, you will try to make prepare for disaster. Of course, you will increase public awareness. Of course, you will conduct simulation that what they should do during disaster. But you will not follow instruction given over phone or radio by higher official or community, because you are there to make decision. They are not seeing the situation, so they can give you any shitty thing to do. Like community loudspeaker, they can say that start praying, we all are going to die. So will you pray or run? Of course you will run, nah? You can pray while running. So community instruction or higher official instruction you will not take, but you will do the remaining three things. So option will be C. Okay. Next, although many animals are implicated in the spread of rabies dogs, what is the if cost-effective and logical way? It is written in PARC. The cost-effective way is reduce stray dog and vaccinate the dogs. This is the cost-effective way which we can do to decrease rabies, and of course Delhi Municipal Corporation is also doing it. Which are the if Delhi Municipal Corporation are doing it or veterinary doctor are doing it, then they should get pre-exposure prophylaxis because they are at a risk of being bitten. Okay, and it is given on day 0, 7, 21 or 28. You understand now? 21 or 28, 3 doses. You understand why they are at a risk of getting bitten now? Because let's say veterinary doctor, why they are at risk? Because one work which veterinary doctor has to do is to arrange for sex of the dog and of course the female dogs, bitches. So if let's say any of the couple do not like the partner, whom they will bite? The veterinary doctor, na, so that next time he bring the better one. That's why they are also at a risk, very risky job. So pre-exposure is 0, 7, 21, 28. Now post-exposure, post-vaccination. Post-exposure you all know. If we give intradermal, it is 0, 3, 7, 28, which is preferred regime because it use lesser dose, only 0.8 ml total. But post-vaccination, let's say you took vaccine and then the dog is still not satisfied, he is in a mood and bite you again. In that case, you have to take it on 2 days only, 0 and 3. Post-vaccination bite, then 2 doses only, 0, 3. Now, which of the following step is not included in step surveillance? See, what is step surveillance? 2-3 question has been came from it and the student find it difficult to remember. So let me help you here. Suppose you want to compare that in China there is more high risk people for diabetes, or in India there is more high risk people for diabetes. So what is step is using to compare high risk population for diabetes and hypertension disorder, to compare high risk population for NCD. So how will you compare India and China for high risk population? You will take 5,000 people randomly from China, 5,000 people randomly from India, and to know the high risk, I have written risk which is hidden behind the logo. So high risk population, to compare the high risk, you will go to their home, those 5,000 people, and you will first ask, what are the psychological factor which can cause diabetes, hypertension and all. For example, psychological factor can be sutta, alcohol, and of course we can write psychological as behavioral, because psychological and behavioral are almost one and the same thing. So along with smoking, alcohol, diet, lack of exercise, decreased exercise, these all are related to our brain, which is causing the illness in us. So we will first ask this thing. Then we will ask the physical factor. Now in the physical factor, of course we have BP, we have the age, we can ask more than 65-year independent risk factor for CVD, and then we will measure the BMI, which is also known as Quetelet index. After physical factor, the last thing which we measure is hormonal factor, or hormonal factor can also be called as biological factor. In the biological or hormonal factor, in India we only measure random blood sugar. But in developed country, of course like UK and other Netherlands countries and all, Scandinavian country and all, we measure lipid profile and thyroid profile as well. So they have asked two questions from this part. One is this question, that which of the following is not included, and you can see which are not included. We are including physical, we are including psychological, which is same as behavioral. We are not including therapeutic, so this is the answer, therapeutic. Second thing they have asked from here is, which of the following test is not done in step surveillance? Recent FMG exam they have asked. Option they had given was lipid profile not done, random blood sugar not done, BP is not done, or waist circumference is not taken. So waist circumference is not taken, mid-arm circumference is not taken. Okay. There are 5 tests we do. There are 5 indicators we use. What are the 5 tests? 5 tests are BP, BMI, RBS, lipid profile, thyroid profile. 5 factors are, easily remember, physiological, psychological, biological, behavioral, and hormonal. Okay, BPH, benign paroxysmal something, or benign paroxysmal hypertension is there, BPH is there, or benign prostatic hypertrophy is there. So that is there. BPH is the mnemonic for the 5 factor which include. We don't include therapeutic, we don't do mid-arm circumference. Okay, next question. A male patient, someone like me, diagnosed with tuberculosis, and on the sputum examination, it was found to be negative, Jerdon smear negative. What is the next thing you will do? Can you answer this question? Oh, okay. This was a different question. The question was, Jerdon smear was done. Now there is 3 things which can occur. There is 3 definition which can come out from here. First, Jerdon smear at end of 6-month treatment, at end of treatment. Suppose Jerdon smear is not done. Suppose I am a migratory worker from Bihar, I am anyway from Bihar, and I am taking treatment from you in Bangalore, and then at the end of 6 months I said कि सर जी हमको अपनी महरारू की बहुत याद आ रही है, फोन पे अजीब अजीब सांसें लेती है, हमको रात में रहा नहीं जा रहा है, हम जा रहे हैं बिहार. So you have completed the treatment, but you don't know the final result of the Jerdon smear. In that case, if Jerdon smear is not done, we will just classify it as treatment completed. Nothing, we cannot say anything about result, but treatment is complete. Second thing, I did Jerdon smear and report came positive. So I was very happy. Oh, something positive came. But it was a sad news, because positive means treatment is failed. Treatment failure. But if the final report came negative, negative is a good news. It means I am cured from BP. So cured will be the answer because here the report is negative. So this three thing very easy to understand. Not done, completed, positive, failure, negative means cured. Okay. Now when do we call it as a new case? New case has two definition: who had not taken ATT in past, or if taken ATT, duration is less than 4 weeks, then we call it as new case. Okay, new case of this, of course, TB. Next question. A cohort study was done and the relative risk factor came out 0.84. I hope you all know, if the relative risk is less than 1, like here 0.84, less than 1 means there is negative association, or negative is also known as protective association. So negative or protective association. That means, let me explain this part better. And if the relative risk is equal to 1, 1 means no association. So they ask a clinical question from here. They will give that 95% confidence interval in relative risk is 0.8 to 1.2. So you can see 0.8 to 1.2. It means in between 1 will come now. If you move 0.8, 0.9, then 1, then 1.1, 1.2. So there is 1. That means this is showing no association. If the range has 1, no association. Very common clinically they ask this difficult question. Acha, now what does this negative or protective association means? It simply means here we are talking heart attack in green tea drinker who are drinking green tea, and heart attack in non-green tea drinker who are not drinking green tea. So let's say they have taken 1,000 people here, and they did this survey for 10 years. 84 people had heart attack even when they are drinking green tea, and 100 people have heart attack in the group when they are not drinking green tea. So the final result will come 0.84. And 0.84 relative risk means if you drink green tea more, heart attack will be less. That's why it is negative or protective. Negative or protective. So that means green tea reduces the risk of diabetes or reduces the risk of heart attack. But one more question they can ask from here is that what does this 0.84 means? Does this 0.84 means 84% less or 16% less? What does it mean? So it's quite obvious, you can see it yourself, that 84 is 16% less than 100, not 84%. So 0.84 means 16% less risk of heart attack, not 84% less. If they say 0.7, 0.7 means 30% less risk. Whatever come in point, you will subtract it from 1, then answer. Okay? And if the relative risk or odds ratio, if more than 1 means the disease is caused by it, it is causative or positive association. More than 1. Very common area of question, do remember it. Now, my friend is asking, is it a case control study? Of course not, it is a cohort study because of two reasons. First reason, they are calculating risk ratio, which is calculated in cohort. In case control, we calculate odds ratio or case control study. Second reason, we start with drinker and non-drinker of green tea. That means we start with exposed, non-exposed, and then we followed them in future to see who have more diabetes or heart attack. So exposed, non-exposed, that means it is cohort. And there is one more third reason which is not written, that here we are calculating incidence of diabetes, and incidence means new case. And when will you have your new boyfriend or new girlfriend, in future or in past? Of course in future. So incidence can only be calculated in future. That's why it can only be calculated in cohort study. Okay. Now, which statement refer best for criteria of stating an urban community health center? Urban community health center for population of 1 to 1.5, no dear, it is 2.5 lakh to 5 lakh population. It refer 2-3 primary health center? No. Urban health center have 5 PHC under it. 5 urban PHC under it. No sub-district and district hospital present in the area. Again, it is wrong. Urban health center can open near medical college or district hospital. It can open. No word is wrong. Now you will say that, sir, why? If there is already a medical college, why are we opening CHC there? So that less serious patient will go to urban CHC, more serious will go to medical college. So remember, urban CHC can be opened near sub-district district. No is a wrong word. It can open and should have a bed facility of 100 in metro. This is correct. So let me briefly summarize how the National Urban Health Mission work. First is mass. Yeah, Tufan Utha De. Have you seen that movie? Nagarjuna is there revolving the leg. Whenever it revolves the egg, there is this thunderstorm which will come out. So this is Mahila Arogya Samiti, group of urban female who hold monthly meeting and report to Usha. Usha is at a population of 1,000 to 2.5 thousand. Average is around 2,000. Usha report to urban A&M, which is at 10,000 population. Urban A&M report to urban PHC, which is at 50,000 population. Urban PHC report to urban CHC, which is at 2.5 lakh population, but in metropolitan city it can be 5 lakh also. And then urban CHC report to MC. MC means medical college. So you can see it yourself that 2.5 lakh is here, 50,000 is here. That means under one urban CHC there will be 5 urban PHC. Population is 2.5 to 5. Then one question, and Usha is 1K to 2.5K. One question came in recent FMG exam that which of the following is not present in National Urban Health Mission? Subcenter, PHC, CHC. You can see there is urban A&M but no subcenter. So subcenter not in National Urban Health Mission. That is why in Delhi we have Mohalla Clinic, and in Tamil Nadu, Amma ji government has opened this Amma clinic in slum areas. But then the recent government of the successor of Lenin, I don't know, forget the name, he closed those center, which is a very sad event. And we should not close any facility given to urban slum population. So remember, subcenter is not in that area. Now, sir, who do active surveillance? Dr. Medico has a question. Who do active surveillance of TB? ASA or MPW male? So for TB, we have a new post, TB health visitor. This is separate than ASA and MPW. This is a new post. This one TB health visitor is at 1 lakh urban slum population. And he go door to door and collect the sputum sample and do judicial smear and then give the treatment. So this is the person responsible for active surveillance in TB. And active surveillance, I hope you all know, is for hidden case which need to be identified. Okay, very good. Now, in an urban area, state of MP, a primi gravida, let's say the mother of my friend Saif Ali Khan delivered. Not mother, sorry, girlfriend. I am the mother, girlfriend, another girlfriend. He is having some other affair in MP also. And motivated by ASA, now how much money will be given to her under JSY? So to remember the money, we have to understand that the money given in low performing state and high performing state are different. And it's easy to remember the money. How to remember? First of all, in rural part money is different, urban part money is different. Then money given to mother is different, and of course money given to ASA is different. And in urban area, ASA is not there. Mother is always there. Urban area, USA is there. But sometime in exam, they can write USA as ASA. That's okay. Don't get emotional there. So if they write ASA, it's okay. Now, what do you mean by low performing states? Low performing states are those states who have high maternal and infant death rate, high IMR and MMR. And guess which state has highest IMR and MMR? Of course, no one can beat Bihar here. And my state is leading it. In our ragging time, when our senior used to ask, where are you from? We used to say, we are from United States of Bihar, USB. So Bihar is there, then the brother of Bihar, Jharkhand is there, UP is there, then brother of UP, UK is there. Huh? We have a UK also in India. And then, of course, MP, the neighbor of UP, and then Chhattisgarh is there. So this 6 is easy to remember. They are Bihar, UP, MP, and they are divided, brother. In 2000, they were separated. So 6 is easy. The remaining 4, there are total 10 states which are low performing states. Remaining 4 can be remembered by the mnemonic Roja. Roja jane man, tu hi mera dil, tuj bin tarse naina. So this is Rajasthan, Odisha, Jammu and Kashmir, which is J&K and Ladakh now, and Assam. So these 10 states are low performing. Of course, low performing will get more money than high performing. So in the mother of low performing get 1400, here half of that 700. Mother of urban area get 1000, half of that is 500, but mother never get less than ASA. So it is 600 which she get. Now, always this 4 digit you have to remember: 1400, 700, 1000, 600. 1400, 700, 1000, 600. 1400, you understand? Now, ASA in rural area always get 600. Usha in urban area always get 400. Okay, so by this way, you can remember this table. Now, come to where the girlfriend of Saif Ali Khan delivered. In urban area of MP. So first of all, you have to go to this part, the urban part. And MP is where? Low performing. So first ASA will get 400, mother will get 1000, like that. They can keep changing the name of the states and they will ask the question. If I ask rural area of Bihar, let's say my girlfriend, my wife is also from Bihar, but she is in Dhanbad, urban area. So urban answer will be same 1400. But say rural area of Bihar, answer will be 1400, 600. Rural area of Haryana, 700, 600. Rural area of Rajasthan, 1400, 600. Like that they can ask and you can always answer. Avnish is saying, आज तो X की याद मत दिलाओ sir. कोई बात नहीं. X is gone, bro. Just like my love is gone, so the X is gone. Don't worry. Come here. Which of the following agency provides seed and manure of applied nutrition program? That is UNICEF. What does UNDP fund? Sustainable Development Goal. What does CARE Foundation fund? ICDS and Anganwadi program. Okay. What does WHO fund? A lot of disaster related work, corona relief related work and all. Similarly, they can ask who fund the sanitation work and who fund the National Institute of Health Administration. So answer for this is Ford. ऐसे याद करो, फोड़ के हगा, defecated and burst the western toilet, है ना, फोड़ के हगा. So sanitation work फोड़ के. And of course, if you इतना हगोगे अगर, if you defecate this much, you have to take the bath na. So nihai means bath है ना in Hindi. So nihai after फोड़ के हगा. Care we do through little children. So care is for ICDS and Anganwadi. Little children food we give. Then Rockefeller they can ask. Rockefeller is to make the foundation rock solid. And to make the foundation rock solid, all the research should be done from India so that we should have the patent and earn money from all the drug. So research work is funded by Rockefeller, and National Institute of Virology, which is in Pune, is funded by Rockefeller. Okay. Then Red Cross. Red Cross was made for helping the soldiers which are injured in the war. So war victim and disaster relief work is done by Red Cross. Then in the last 2023 NEET, they have asked who fund the Colombo plan. What does Colombo plan fund? So it is so easy to remember. CO for Colombo, CO for Cobalt Therapy Unit. Second thing is, along with Cobalt Therapy Unit, Colombo Plan fund agricultural and industrial development work. And Colombo Plan also gave fund for AIMS New Delhi. Our first health minister, the best one, was Rajkumari Amrita Kaur. She was a female who who remained unmarried her whole life, and she was from a rich family. She donated her all the wealth to the good health for Indian health system, and then she get fund from New Zealand to open AIMS New Delhi. So all this under Colombo, CARE, Rockefeller, Red Cross, Ford. 5 work you have to remember separately. UNDP fund Sustainable Development Goal. USAID fund the malaria program. UNFPA, United Fund for Population Activity. What does it mean? No, they are not giving money for sex. Population control activity. They will fund family planning program. All of these are very important to revise. Do revise them before exam. Okay? So that is there. Now, many children from particular community coming to hospital were detected to have ALL. It was assumed that it is due to the water which they are drinking. In a case control study has to be done to find whether the chemical and ALL are associated. What should be the control? See, first thing is, case are the one with disease, control are the one without disease. So this is a very easy thing. Now, they are asking about control. Let's start looking at one by one into the option, starting from option D. Option D, all children with ALL. But control should have disease. So children with ALL can never be the control. They will always be the case. Now, option A, children from the area who are exposed. So if you take control who are also exposed, case who are also exposed, what will you study? This is overmatching. You took someone who is very much similar to the case. Children from the area not exposed. Oh my dear, if you take children who are not exposed, then how will you study that chemical is causing it or not? This is undermatching. You are not putting comparable people. And children coming to OPD, this will be the answer. Because then sometime they can have the exposure, sometime they cannot have the exposure. So this C will be taken as control. Children who are coming to OPD. Is this question clear to you or not? I hope it is clear. If not, let me know. I will explain you with some other example this question. Okay, chalo, come. An auxiliary nurse midwife is conducting vaccination. Come. This is based on this open vial policy. And this is the how to remember all the drugs which follow open vial policy. Open vial policy simply means even after 4 weeks of opening the vial, you can use it if stored adequately between 2 to 8 degrees Celsius. The vaccines which follow it can be easily remembered by the mnemonic Hep B, PCV, all tetanus, all polio. Okay? Can you say it with me? Hep B, PCV, all tetanus, all polio. Okay? 4. Just 4. Hep B, PCV, all tetanus, all polio. Some books and references, they write rotavirus and all. But you can see this is recent edition of Park. And they have written it clearly that these are the vaccine which follow open vial policy. And they have not used rotavirus name there or JE name there. These are the vaccine which follow it. Now, how can all tetanus means? It is DT, TT, DPT and pentavalent. All polio means IPV, OPV. OPV is Sabin, it is live. IPV is sock. How will you remember it? I used to think sock laga mar gaya. So IPV is killed. And one friend Pragya, she gave me a very good way to remember OPV. That sir, OPV is in live-in relationship. And this mnemonic came to her because Pragya herself was in live-in relationship with a guy there. Aditya. So this is, or maybe they are good friend only, sorry. So you understand the point. Sabin live, okay? And killed shark. Sock laga mar gaya. Then these 4 easily remember all tetanus, Hep B, PCV, all tetanus, all folio, they follow open vial policy. So we will not throw them. We will throw other, but not these vaccine after our vaccination camp till 1 month, till 4 weeks of opening the vial. So that means we will use Penta and discard MR. We will use all the vaccine which follow open vial policy. So B will be the answer. Now, next question. A 24-year-old male, someone like my husband Saif Ali Khan, recently returned from Africa, reporting having jaundice and hemorrhagic fever. Africa jaundice, they are talking about yellow fever, and yellow fever have this strain 17D. Gerylin is the strain for mumps. RA27, rubella. Edmonston Jaigreb, measles. BCG, Danish, the manish. First write 13 and then opposite of 13, 31. Okay. So do remember it. One more thing, meningococcal meningitis. This meningococcal meningitis, they have the strain ACYW135. So they ask, which subunit is not present in meningococcal vaccine? B subunit is not present. And when asked in exam, people thought that A, B, C, D should be there. Na? How can A, B, C, Y is there? So that's why, don't get confused. B subunit is not there. It is ACYW135 which are there in the meningococcal vaccine. Okay, do remember it. Yes. Mumps, Gerylin. Yes, bro. Dr. Morphin, you are right. Which of the following will increase the lifespan? Decrease calorie intake by 30%. That will increase lifespan. Regular exercise can also help, but it will lead to stress and release of inflammatory markers. Some study has suggested it. I disagree with them, those study. But they say if you eat 80% food, or let's say 70% food, then your hunger, then your capacity, your lifespan will be more. And now I know what you are saying. कि अबे मोटे तू खुद क्यों नहीं कम खाता है जो पढ़ा रहा है? I'm trying for it. Okay. So this is C which is there. Broken glass vaccine vial. We have just discussed all the medicine vial broken will go in which? Blue. Except cytotoxic drug vial. All drug vial, all vaccine vial goes in blue. We have discussed it from Park, the table. So don't get confused and answer blue only. Yellow will be the answer if they have cytotoxic drug in the vial. Now, green color in triage is for ambulatory patient. Highest priority is red. Moderate priority is yellow. Dead or least priority is black, moribund patient. We all know that. And if there is reverse triage like in war, then we give first priority to green, second to yellow, third to red. Lifespan, we have already done it. It is quali. Now, coming to the last year, we have done most of the concept. So, it is easier here. Cross get walking using stand, and they are consuming some rice and pulses. It is neuroletharism, and we have discussed what is the treatment for that. Vitamin C, 500 milligram to 1 gram is the treatment for that. Okay. And they have asked what is the poison also, that is boa. Coming to this question. There was a guy, homeless like me, 35 years, that quite resemble me, and sputum smear turned out to be negative. Chest X-ray order was suggestive of TB. But according to the recent National TB Elimination Program, what is the next thing you will do? See, if 2 Jaden smear is negative, then we go for CB-NAT. But if CB-NAT not available, then we can make the diagnosis of TB based on clinical symptoms and X-ray. So that will be classified as clinically diagnosed TB. So we make the diagnosis only if CB-NAT not available. Always choose CB-NAT if that is the answer. And CB-NAT has one advantage, that along with detecting TB, it also detects rifampicin resistance. So CB-NAT is directly done. We don't do Jaden smear. In 5 category people, Directly CBNAT is done. One is HIV, which was asked in last FMG exam. Second is all case of diabetes, we do directly CBNAT, no ZN smear. Third is all the COVID-19 patients, directly CBNAT. Fourth is all the previously treated who are already treated with TB, previously treated TB. And fifth and last one is pediatric TB. Because you know ना, अगर तुम बच्चे को बोलोगे कि थूक दो तो वो मूत देगा, बोलो मूत दो तो वो थूक देगा, है ना? It is difficult to collect sputum from pediatrics patient, so we directly do CBNAT. 5 case directly CBNAT. Do remember it. Research is being conducted to find association between aniline dye exposure and bladder cancer who have worked in last more than 20 years. So there are two groups, one directly involved and other who are office clerk. And they are using occupational record. Do remember this thing that I have discussed it in our first session in detail, that if they are comparing past written record is compared, that is retrospective cohort, or retrospective cohort is also known as historical cohort. Okay, but along with past written record, suppose if also future follow up is done, if both things are there, then it is going in both direction like a man. So it is man is the mnemonic, mixed cohort, ambispective cohort, or nested case control. So if both are there, then man. Only one thing is there, that's why the answer is retrospective or historical. Okay, go through the first part of this NEET PYQ discussion. In detail, we have discussed how to decide which study is done in which situation. Okay. The blood pressure of a population was tracked from childhood to adulthood. You can see BP is here, age is here. They are tracking the BP. Tiding, 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 tiding. At lesser age or earlier study, let's say 10 year, if BP was less at 10 year, at 70 year also BP will be less. So it's like BP is tracking the person. BP picha kar rahi hai. This is tracking phenomena. Okay. In rule of half, they ask only one thing. What is the innermost circle is telling? Innermost circle tell us people who are adequately treated. That is innermost circle. Okay. Because very few people get adequate treatment of hypertension and diabetes. Now, 30-week primary gravida, there is reduced night vision because they are not eating papaya, because in rural area people say papaya have papain, which is abortifacient, and not, they just avoid it. So whose primary duty is to go to the house and do the screening and refer the patient? This is the main duty of ASA. ASA do home visit, screen, and then refer the patient. Okay, so this is mainly the duty of ASA, which is done, which is there. And of course, we have discussed it. ASA is 1 per 1000, minimum is 8th pass. Oh, now this is a real confusing question. According to the syndromic approach, where will you put a patient who have erosion on the cervix and vaginal discharge? See, I hope you all know that kit 1 is grey in color, and kit 1 is for 3 things: urethral discharge, anorectal discharge, and cervicitis or cervical discharge, cervicitis. This is grey. Green is kit 2, and this is for vaginal discharge. Kit 3, 4, 5 is easy to remember by the mnemonic WBR, white, blue, red, just like WBC. White is used for bacterial genital ulcer, where we give penicillin. Blue is also used for bacterial genital ulcer, where penicillin is sensitive, so we give doxycycline. And red is used for viral genital ulcer, where we give acyclovir. 6 is most commonly asked and most commonly given. It is yellow. Yellow patient is for 3 category. We give it PID, lower back ache, and lower inguinal pain. All these backache and inguinal pain suggestive of PID. 7th is for inguinal buboes, which is black category. Here we give doxycycline for 21 days. So now according to the classification, C have the vaginal discharge, so C can be in green, and C have the cervicitis, so C can be in gray. And different platform write different answer. But again, to confirm the answer, we will go back to Park. Now, in the Park, they have written that for cervicitis, cervical erosion is there. And then this cervical erosion, of course, all the problem in cervix, if there is any problem in cervix, the discharge will come out through vagina only. है ना? Cervical discharge we can detect by doing per speculum examination, but cervical erosion is also considered as cervicitis. Okay, this is not normal. This is suggesting of a disease, cervicitis. And because it is suggestive of cervicitis, which is kit 1, so we will answer this question as kit 1 gray. Okay, and the answer is A, kit 1. It is considered physiological by some of the practitioner that cervical discharge can be normal, or cervical erosion can be normal also. But Park has written cervical erosion as a sign of cervicitis, and cervicitis patient are treated by kit 1. So answer will be kit 1 gray. Okay, chalo. Now next question, the year of potential year of life lost. This is year lost due to premature death. We have discussed it earlier that 68 year is the life expectancy. If someone die at 62 year, then 6 is the potential year of life lost. And this is year of potential life lost, premature death causing it. A 10-year-old child, we have discussed, this is a PYQ in NEET also, PYQ of NEET come, you can see. So we give DT vaccine preferably. If DT in the exam, I have seen the real questions actually, in the exam, only DT was in the option and then TT was another option. So you have to choose DT always. Never choose TT, because now we give DT at 10, 16 and in pregnancy both we give DT. Which of the following statement is true about cancer treatment according to Colombo plan? Cobalt therapy unit is given in Colombo plan. Okay, they just have asked in the real question which is true about Colombo plan, what is done is Colombo plan, and that is cobalt therapy unit. Now, again there is a poor farmer who have crop failure, paralysis, gait instability, that is suggestive of neuroletharism. Cause is BOA. If they gave that someone eat contaminated groundnut, and due to contaminated groundnut they have hepatocellular carcinoma, then the poison is aflatoxin, very commonly asked, 2 times asked already. If they say someone is eating rye or wheat having black color ergot, then it will lead to cyanosis or necrosis of finger. This food poisoning is a very important topic. You can see 2 questions in NEET last year came only from food poisoning. Every year, every FMG NEET exam, 1 question usually come from it. So it is so important. Do focus here. Rye or wheat, why they are causing cyanosis, necrosis? Because the poison is ergotoxin. And I hope you all know ergotamine group of drug, sumatriptan and all, they are used to relieve migraine. How they relieve migraine? In migraine, the pain occur due to abnormal vasodilatation. So these all poison, these all drugs, they cause vasoconstriction. So the same thing they are doing here also and causing vasoconstriction, leading to cyanosis or necrosis of toes and finger. Sometimes it can also cause hallucination, which also occur with LSD, and of course hallucination can be there also. Okay? So that is there. Now fusarium toxin, it's not need to be read. Main thing is we confuse between endemic ascites and epidemic dropsy. So it's very simple. Ascites occur in the stomach, which is in Hindi is known as pet. So ascites will have which poison? Pyrrolizidine, pet. P for pet, P for pyrrolizidine. The poison is pyrrolizidine and it is due to eating crotolaria with panicum miliare. Poison is adulterant is panicum miliare. Okay. which is also known as jhunjhunia. When wind blows, it produces the sound of jhun 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 jhun. In tribal areas, when I was working for 3 months, this was the musical sound in the air which I used to listen many a time. Jhun 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 jhun. This is coming from this plant, so they call it local area jhunjhunia, because the kernel is big, seeds are small. So when air blow, they produce the sound jhun 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 jhun. Okay. Now, epidemic dropsy have the poison sanguarine. Imagine you are sleeping with someone of your dream. Okay, I can imagine Saif Ali. First thing, you will not sleep. But if you sleep, as for sleeping, as for sanguarine, in sleeping there will be dropping of the eyelid, and the symptom of dropsy is bilateral pitting edema. So again there is pitting, dropping. Bilateral pitting edema of leg will be there. Okay. So do remember these poisons and these food poisonings, very important area to revise. Now, a young male came to hospital with clean cut wound. We have discussed it. See again, NEET question repeated in NEET exam itself. Here only 1 dose of TT is given. Okay, we have discussed it in the first 10 minutes of the session. You can see it there. How is water collected for bacteriological examination during disease outbreak? Collect water already leaking tap? Of course not. Before collecting, let water flow for 1 minute. No, dear, it's not 1 minute. It is more than 2 minutes or 2 minutes at least you should go. So this is also wrong. Collect water kept close to tap. If you will put close to tap, the bacteria which is in the tap will also come in your tube now. So we should not keep it close to tap. We should keep it at a distance, and we should take gentle stream of water to avoid displacing. D is the correct answer. And to confirm it, you can see that again, we can go back to the park. See, they have written 2 minutes, not 1 minute. Okay. And we collect gentle stream. You can see this is written, we tap should be sterilized by heating it with a blow lamp. Then they should cooled. Bottle should be held near the base but not touching it. Then sample bottle should be filled with a gentle stream of water from the tap to avoid displacing. This was option D, which is correct. This was option B. 1 minute they have written, so it was wrong. Okay. Now, these 2 things. One is average daily dietary nutrient intake. This is known as RDA, recommended dietary allowance. RDA is something which will fulfill need of 97.5% of the population. So this is RDA. But in FMG exam just 6 months back, they have asked this question, that dietary need of 50% population is fulfilled by what? So 50% population is fulfilled by this estimated average requirement. This estimated average requirement fulfill dietary need of 50%. 50% is EAR, 97.5 is RDA. Okay. Next question is about chicken pox. Remember, in chicken pox, isolation is for 6 days. So only A or C can be correct. Second point, varicella zoster immunoglobulin should be given in 72 hours. So these 2 points are correct. But varicella zoster immunoglobulin is not given to adult. Why? Because adult don't have serious complication of chicken pox. See, suppose in my home there is a pregnant wife, pregnant mother, my wife, or me myself also, and there is an old age lady, my mother. Of course, a kid is there in my home. Infant is there, less than 1 year. So who should get the preference? Kiski sunu main? Maa ki sunu ki biwi ki? Who should get the first preference? First preference should be given to pregnant mother, because it can cause congenital anomaly. So we don't give it to adult, and varicella zoster immunoglobulin first given to pregnant female, pregnant lady. So it is not given to adult, and here they have written boy hostel. So they are already adult, or not adult, then they are already past the infancy stage and all. Serious complication cannot occur in them, so we will only isolate. Okay, if it is not boy hostel, let's say it is a ANC clinic where pregnant female are coming, then the answer will be A. Or if let's say there is old age home, if they have written old age home, answer would become option A. But here answer is C because it is boys hostel. Which of the following is sensitive indicator to assess availability, utilization, effectiveness of healthcare? IMR is the best indicator. IMR tell about three things. One is the thing, how is the healthcare? Because if healthcare is not good, more children will die. Second thing which IMR tell is impact of ASA work. If ASA will work well, IMR will decrease. Third thing which IMR tell is female condition in that area. Because what is the most common cause of IMR in India? Separate question. Most common cause is premature delivery before 37 week. That means most common cause of IMR is that mother condition is not good. She is malnourished. So she is unable to hold the baby till 37 week, which lead to infant death. So if there is more IMR, it means malnutrition is more in female, and that will indicate female condition also. So that's why IMR is the best indicator of these three things, not just one thing. And that is why PQLI is better, because in PQLI, to measure the socioeconomic condition, we use IMR, literacy rate, and life expectancy at 1. This is confusing question come at PQLI HDI, but it is very simple to remember. PQLI is 4 liter bigger, so the life expectancy is 0 to 100 bigger. The range is bigger, 0 to 100. HDI range is only 0 to 1. Second thing is, in PQLI, you can see it is written life expectancy at 1 year. LI means L1, like that. So these are the three things in PQLI. In HDI, we have life expectancy at birth, per capita income, and years of schooling. So that's all from all the question of NEET exam from 2018, 19, 20, 21, 22, 23. 6 years we have done, because 2017 and before that, the pattern was different. Multiple exam used to come, so one-liner was more. Still some one-liner there, but that time the pattern was different. Otherwise, I was planning to do 10 years of NEET. And I will come with 10 years of INI-CET question discussion starting from 25th of this month. Maybe 25th and 26th today, I will do INI-CET 10-year discussion. And I will update it on my WhatsApp. My WhatsApp number is 8860796675. This is our gynae faculty, very good gynae faculty with more than 15 years of experience, Dr. Harmeet Goyal ma'am. This is not her number, this is my number. And I will update on the status of my phone, and on NExT you will find the detail of my session. And I am putting this slide here to make you aware that from 7 p.m. today, there will be a session of Obs and Gynae rapid revision, very useful session to improve your score in Obs Gynae by Dr. Harmeet ma'am. I hope today you enjoyed the session and you learned many new things. Please do revise those important things which I said. This page must revise before exam, this page must revise. Do revise all the morbidity indicator, all the correlations coefficients and all the tetanus vaccination things from this session. These are the important part. From last session, and of course food poisoning part is also important from this session. Last session, different type of study, how to decide, then all the GFR, TFR classification, and that these 6 areas are something which you cannot miss before exam. In every exams, almost one question come from these 6 areas. These are so important areas. I have my best of luck for all of you, and I truly wish that you get real happiness in your life by helping needy people, and enjoy your life, enjoy the journey. If you have any question to say, anything you want to say, if you want to abuse me or say anything to me, you can say it directly right now. And any doubt, anything, you can ask. Dr. Medico is asking, sir, you will be at the exam center. Yes, dear, I will be at the Meerut exam center with my beloved friends. Okay. Mansoor Alam has a question. How is water collected for bacteriological examination during a disease outbreak? Same process. Same process as we use for tap water collection. The same process we use there also. Okay. So very good. You have anything? The rashes in chicken pox is centripetal. More on trunk. No rashes on palm and sole. Monkey pox, smallpox are centrifugal, palm and sole. Centripetal is more on trunk. CP centripetal. One more thing you have to know, they give photo of measles and chicken pox child very commonly. Measles rash, you all know, start from back of hairline, back of ear, then go to face, then to body. Main thing is, why they call it chicken pox? Just like beak of chicken. Chicken pox rash come out. है ना? तो एक डॉक्टर था जिसके अंदर एक सायर था, उसने चिकन पॉक्स के रैश को समझाया कि ऐसा लगता है जैसे गुलाब की पंखड़ियों पर ओस की बूंदें हैं क्या? पीप भरे हुए दाने. लेकिन see the beauty in the eye of beholder. He see that as dew drops on rose petal. So just like rose petal dew drops, chicken pox rash will come out. Measles will be in the skin surface. That's why measles are sand particle rash. Very common question. Second point, measles is with cough, cold, coryza, conjunctivitis. So water will be coming out from everywhere. But rubella, chicken pox, both are dry fever. Water will not be coming out from anywhere. So I hope you will be differentiating these two very easily. Any other question if you have? Ritesh is saying you teach very good. Shukriya Ritesh, I love you too. And then, sir, I want to dance with you, Jimmy Jaipur. Yes, bro, I have given you my number. Call me after the exam. We will have a dance party together and we will rock it. And sir, I am literally blank. I am not understanding what to do in these 2 days. If you are in the last 2 days or last some time of exam, do this 3 work. First work, do previous year question. Simple. Very important to do PYQ and topics of PYQ. Second thing, start taking blessing from your mother or the nature or wherever you believe every day. That blessing will keep you motivated and will give you correct idea what to do. And third thing, in the last day of the exam, when you are going on bus, don't try to revise whole subject. Just read your strong subject so that you are confident while entering the exam. And you all know, if you are confident, 20-30% question, you can do it just by the presence of your mind. So do this 3 work in last 2-3 days and I am sure you will rock. Okay. So thank you so much for your loving support and your energetic replies. Love you all. We will meet again. Till that, hasta la vista, das ka dhaniya. Hasta la vista, bistara sameto. Bye bye. Thank you so much. Thank you so much, my friend.